It's not changing. It's not changing, but. Yeah, I have laptop. No, no, not there. Should we take with, do with, yeah. Before I talk about neural tube defects, we'll just see prevalence of birth defects worldwide, Southeast Asia, and in India. In every year, there's 6% to 3% to 6%. Okay. What is this? Every year, 3 to 6% children born are with birth defects, severe birth defects. And in Southeast Asia, 51% per 1,000 births are of severe birth defects. In India, 8 to 12 per 1,000 births are of severe birth defects. So, but in India, there's no as such prevalence. So we cannot say how much is the accurate number of the birth defects because, yeah. Okay. So what is the best way to measure the prevalence of birth defects is population-based study, which is census, which is lacking in India. In that, we should mention how many cases every year or every 10 years we have. Then, can you change? So, Spina Bifida Foundation is also taking efforts to register few cases with Foxy and Mayo Vitabiotics. We have developed an app. Prevalence of neural tube defects worldwide, Southeast Asia and India. So if we see worldwide, neural tube defect cases are the commonest one. Every year, 260,100 children are born with neural tube defects. And amongst them, 75% do not see their first birthdays. In Southeast Asia, the numbers are more, 0.1, this is working. 0.19 to 6.2 per 1,000 births. So if we see in India, the estimate prevalence, because we don't have birth defect registry, so prevalence of this is tentative or estimated. So 4 to 5 per 1,000 cases per year, as per Anita Kar's and others' research. In India, that means it occurs around 1,20,000 births every year. In India, it is largest number because 1% is acceptable, 1 case per 1,000 is acceptable, 4 is 3 times more. Out of which 50% are anencephaly and 50% are spina bifida cases. That means 50,000 cases every year are born with neural tube spina bifida, as per Godfrey and Conchera's research. So what is the cause for spina bifida or neural tube cases? These are the main some cause, high temperature, hypothermia, or anti-conversion pills. Apart from that, folic acid can prevent. See, this is preventable, yet people don't know, especially women don't know. So 75% of neural tube defect cases are preventable by just taking folic acid periconceptional. You all know that because you all are doctors. And vitamin B12 can prevent folic acid. Vitamin B12 can prevent 85% of cases if taken before pregnancy. Then what can be done in India to prevent this? Which is awareness, supplementation, and fortification. These are three main aspects which India has to take, in the sense government has to take initiative to prevent this. Awareness like pulse polio is most important because everybody knows Ek Bund Zindagi Ke Naam, which has changed, and the numbers of cases has almost decreased, it has eradicated the polio. Similarly, at least we can achieve some goals and we can eradicate, not eradicate, at least we can, 4 per thousand births, then we can reduce to 1. So this campaign can be done. So if we see supplementation versus fortification, supplementation is directly effective, and fortification is indirectly effective. And if we see many 50% cases, 50% are unplanned pregnancies. So sometimes people miss taking folic acid, or they just forget. So India doesn't, but in case of fortification, we do not buy branded products, especially wheat flour, rice flour. In many parts of the region, they buy grains, they give it to millers to mill, and then they do not buy any branded products. So this is the issue. So, but India can do all these three things: awareness, supplementation, and fortification program to prevent or to at least reduce the cases of neural tube defect cases. As far as fortification is there, you can see where we stand. After 2018, India has reduced the standards to 90%. It has reduced lower than what is recommended by WHO. So where we stand, you can see. And in many countries have mandatory did the fortification, and you can see the results, how much it has reduced. What can be future fortified? Because in India there's an issue that we do not buy branded products or anything. So anybody guess? Anybody can tell what can be fortified? Any guess? Or anybody can suggest what can be fortified? Huh? What? Tea. Tea. Yes. Salt. Yes. So this all things can be fortified as far as India is concerned, because these are consumed by many. There are some researches going on where we can double mask in salt, and this is where foundation is also taking initiative in tea fortification. So you can see where these are the countries where they have taken initiative for awareness, fortification, and supplementation program, and see they have saved their money. If we spend 1 rupee in prevention, we can save our 38 rupees. So when we talk supplementation and this, that, so when why can't nature had given any food which cannot give sufficient folic acid? So we have just during one meeting we have discovered this. So can you guess which tree is this? Not me, but that tree you can guess. Huh? Yes, it's a drumstick tree. It's a moringa tree. Researches are going on. I hope this research gets, and we can get enough folic acid through these leaves of moringa leaves. So Thank you. Thank you for listening. Thank you. Yeah.
Thank you so much, Sneha, for an interactive discussion. We just got news that Governor Ma'am is on her way. So next we'll start arrangements for Governor Madam's entry, and then we'll carry on our program from there on. Now lighting the lamp is Dr. Santosh Karmakar sir, the founder and trustee of Spina Bifida Foundation, an eminent pediatric surgeon with expertise in spina bifida and neural tube defects. Now lighting the lamp is Dr. VVS Chandrasekharam sir, who is the chief consultant pediatric surgeon and pediatric urologist of Ankura Hospital. Now lighting the lamp is Dr. Krishna Prasad sir, who is the founder and managing director of Ankura Hospitals for Women and Children. Now lighting the lamp is RSV Krishna sir, consultant senior pediatrician, Ankura Hospitals. As we begin our journey, let us invoke the blessings of the divine with a prayer song by Mahi, accompanied by, on the tabla, Amar. Mahi is a first-year student of dietitian and a businesswoman. She is a classical singer and an artist. She represents Mumbai female wheelchair cricket team. She is the youngest female wheelchair cricket player in the world and also the vice captain of the team. She has also designed the jersey for India's wheelchair cricket team. Amar has completed bachelor's degree in commerce and master's degree in business administration and field of finance. Currently working as accounts and finance assist in NDT Services Private Limited, Aurangabad. He started learning tabla at the age of 10 and has performed at several events.
तू बुद्धि दे, तू तेज दे, नव चेतना विश्वास दे। तू बुद्धि दे, तू तेज दे, नव चेतना विश्वास दे।
Thank you, Mahi and Amar. This year, Ankura Hospital has liaised with Spina Bifida Foundation to start the Telangana Chapter of Spina Bifida Foundation. The objectives include raising awareness about Spina Bifida, spread the message about importance of preconceptional folic acid in the prevention of Spina Bifida, develop multidisciplinary team of doctors for comprehensive care of Spina Bifida, create a forum for families for social and emotional upliftment. We are extremely delighted to have you, ma'am, today at the inauguration of the chapter. To introduce our esteemed governor, words I fall short. So Dr. Srimati Tamilisai Soundarajan, ma'am, is the first female governor of Telangana, has over 2 decades of notable public service and a thriving political career. After earning her MBBS and postgraduate degree in gynecology and obstetrics, ma'am began her career as a medical practitioner. She further honed her expertise through specialized training in ultrasound and fetal therapy in Toronto, Canada. For 7 years, she served as an assistant professor in the Department of Gynecology in Sri Ramchandra Medical College in Chennai before transitioning into a full-time politician in 2003. Recognized internationally for her contributions to the society, she is committed to improving healthcare and education. Driven by a deep appreciation for India's cultural heritage, she advocates for values and humility in education. Her focus remains steadfast on enhancing the society and citizens' well-being, even at grassroots level. Now I request Madam to say a few words.
A special good evening to each and everyone here. Dr. Krishna Prasad Vannam, Founder and Managing Director, Ankura Hospital for Women and Children. Dr. VVS Chandrasekharan, Chief Consultant Pediatric Surgeon, Ankura Hospital. Dr. Santosh Karmakar, Senior Consultant Pediatric Surgeon, Lilavati Hospital, Mumbai. Founder, Trustee, Spina Bifida Foundation. Dr. RSV Sri Krishna, Treasurer, Indian Academy of Pediatrics, Twin Cities. Dr. Jayashri Reddy, Gynec. Dr. Pingali, Pediatrician. Pingali? Dr. Pingali, am I pronouncing? Pediatrician. Dr. Sugunakar Reddy, Dr. KVS Narayan, Dr. Nagarjuna, and all the other dignitaries who have assembled here. And apart from that, my dear friends who performed the musical instrument here and taking photos and singing, they are my special friends, and my respects to them. And I really appreciate Dr. Santosh Karmakar, Founder Trustee of Spina Bifida Foundation. He was so proud that you can see the performance of my children. And like a motherly affection, he mentioned about that. And this is, I'm really happy that it is, when she said, it is the celebration of defects. So, it is a different form of life, that's all. When I was asked to attend this program, actually I landed here by 4:30, got the 4:30 flight, landed here by 6 p.m. and I went to another program which is organized by an NGO to support the autism children. And again, I came to attend this program. Exclusively for these two programs, I came, and I'm returning by 9:15 flight. And particularly Spina Bifida, it is a, I cannot say it's a defect. It is a condition which is very much nearer to my heart. As a gynecologist, as a sonologist and a fetal therapist, who was practicing not gynecology but fetal therapy, particularly after becoming a postgraduate in gynecology, I had my training in sonology little earlier than I entered as a postgraduate of gynecology. But because I was diagnosing most of the anomalies, even though I was a postgraduate in gynecology, I was not much interested in conducting the deliveries or gynec surgeries, but I was interested in diagnosing and correction of the anomalies. And because of that, I am the second person who went for the training in fetal therapy specialty to Canada from Tamil Nadu before 25 years. And what motivated me that anomalies which I found during the antenatal screening, not only that, the society, here why I wanted to attend this program, to support the cause, because the society should be aware of such conditions. And not only aware of the conditions, highly prevention, as it is said in the introductory program, meeting, speech, administration of folic acid, and awareness about the spina bifida, and awareness about ultrasound screening. Even now, during my tenure as an assistant professor in gynecology, in charge of ultrasound, I found one baby just prior to the term, a big hydrocephalus, spina bifida, which could have been diagnosed much earlier in the first trimester scan itself. But why I was asking, why you didn't do a scan? Then she was telling, no, my mother-in-law told, your husband was very healthy and I did not do even a single scan. So whenever I asked for a scan, my mother-in-law used to say, no, it cannot be done because that is not needed. So even now we live in a society like that. And apart from these tablets, in a lighter sense, I always used to say, when I was a postgraduate, and I was a house surgeon in Tanjavur Medical College, a peripheral hospital, medical college, a village hospital. When we prescribe iron tablets, why I am telling, it is not only prescribing, making the people aware of the condition and making the people aware if it is not taken, what all the problems the baby may face and what the mother may face and what the society will teach you. So when we prescribe some iron tablets, when we go for our lunch period outside, we used to see the iron tablets thrown in the grounds. So we used to pick it up and call the mothers and ask, why did you throw the iron tablets? You are anemic. Why did you throw the iron tablets? They used to say, no, it is dark in color, black in color. If I take this, my baby also will become black in color. It is fact. So I used to say, you see, we are all dark in color only. We have become doctors. So why you want to do that? So in a lighter sense, I used to appeal to the pharma companies. Ladies always love multicolors. So please produce iron tablets with multicolored tablets, not black colored tablets. So it may appear very silly, but something to be corrected from the basic need, and particularly ultrasound awareness. This spina bifida, and a talented ultrasoundologist will definitely pick it very early. And I have seen so many cases, and why I wanted to attend this program, because I am very happy Telangana chapter is initiating this awareness, and I congratulate them, because these minor defects, minor problems are not on focus. I always say, during our medical curriculum also, we will be talking about Kala Azar, myocardial infarction, but we won't be talking about diarrhea, fever, which day to day we see. So we have to focus on those things. Somebody think, no, we are talking so great things, but why to concentrate on these things? But you can see the children with conviction, they have overcome these deformities and they have challenged the deformity, and now they are challenging the world so that they can perform. So it is our duty to protect these children. And nowadays I see there are fetoscopic surgeries also there. Pediatric surgeons will be throw more light on that. And awareness about this, prevention, and if at all diagnosed, and then treatment immediately, because few hours it should be corrected. But in our families, if we tell something, to take a decision itself, they will take such a long time in this society. So make them awareness about that. And then cost of it. I always laud our Honourable Prime Minister, because of the Ayushman Bharat, the tertiary treatment number has risen, because the people were unable to get the tertiary treatment for want of money. So now the governments are supporting, and as a governor, for these type of defections, what all the support should be rendered, definitely I will do, because I am not only a governor, I am a doctor, and particularly a fetal therapist. So it is the society we should protect the children, and it is the society should take care of them. We cannot just ignore, because the society still, we cannot say we have reached, the medical knowledge has reached the people in the rural areas. In a lighter sense, I used to say, when I was practicing ultrasound, one day I told a village person, so that you should come with full urine to study the prostate. Next day, I asked him, have you come with full urine? He told, yes, I have come with full urine. Okay, come and lie down. No, he told, no, first I have to submit the full urine. So he took one Horlicks bottle with full of urine, second Horlicks bottle, third Horlicks bottle. You only asked me to come with full urine. From yesterday night, I caught the urine, I have come with full urine. This is the understanding. So we have to deal with the society like this. And nowadays, my husband is a nephrologist. He used to say, before and all, we used to compete with the doctors. Now we have to compete with the Google. So if I convey a diagnosis, you are suffering from, then the patient says, oh, doctor, you are telling this, my Google says this, which is correct. So my husband is now, before he used to learn the medical books, now I have to Google and see what this Google is saying, so that I have to counter the patient's knowledge about the half knowledge they gain through the medical knowledge through Google. So it is not easy to deal with. It is not easy to deal with a patient. It is not easy to convince them. And when the whole family is expecting a well-born child, and if we convey that these type of defects, the family is unable to accept it, and immediately they are unable to go for the treatment, and immediately they ask for full guarantee. Doctor, you guarantee everything. So as a doctor, we cannot say, because God itself, nature himself not given such guarantee for some of the defects. So these all should be thought of, and really these type of programs, these types of gatherings definitely will help the patients with these defects, and it will be more helpful in prevention and more helpful in exploring the innovative procedures, because this is the era of innovation, artificial application of artificial intelligence, and what all the technologies can be used. So with all the support, we can prevent the disease. If at all diagnosis, early diagnosis should be there, and early correction should be there. And my request is, these children who have challenged the defect should be appreciated and lauded. My salute to you all. Thank you.
Thank you so much, ma'am, for the enlightening words. It was such a pleasure to hear what you were saying. I mean, it is awakening, it's an awakening call for all of us as doctors, as a society to rise and be there for spina bifida fetuses, babies and adults. Yes, adults too. Now I request our dignitaries to honor ma'am with a shawl and a memento.
On behalf of the foundation, I must say that we are extremely honored and delighted that the Telangana chapter is being launched, and I'm very happy that at the first day of the launch of this very important chapter, we have none other than Dr. Tamilisai Soundarajan as the patron of this new chapter, not just as governor, but also as a doctor and obstetrician. So you have the best combination of a patron in the chapter. And I must mention that Dr. Tamilisai mentioned absolutely correctly and highlighted the main problem as it exists as far as neural tube defects, and that is awareness. Tremendous lack of awareness. No woman, whether it's rural, urban, is aware that folic acid taken before birth can prevent this condition. So on behalf of the foundation, I'm going to request Honourable Governor to take the lead in Telangana to create an awareness campaign, something on the lines of Pulse Polio. We have had a couple of meetings with the Central Health Minister last year, this year. We are trying to sensitize them to this, but I think awareness is something of prime importance. So thank you very much.
We'll give it later. Now I'd like to request Dr. VVS Chandrasekharam sir to propose the vote of thanks.
Very good evening, dignitaries and friends. First of all, I thank our Honourable Governor, Dr. Srimati Tamilisai Soundarajan Garu, for graciously accepting our invitation at which is very short notice, and as you heard, she's been extremely busy with her programs, but she was so interested in this subject that she gave us all this time to grace this occasion, and then she also blessed the heroes, our real heroes, the Spina Bifida patients, and she also inaugurated the Telangana State Chapter of Spina Bifida Foundation. Thank you so much, madam. I thank Dr. Santosh Karmakar, who is the brain behind the Spina Bifida Foundation. He was 20 years ahead of all of us, and his efforts are going a long way in helping these children, and we are also trying to chip in and do our best. Thank you, sir. I also thank Dr. Krishna Prasad and Ankura Hospitals, including our marketing team who have done a great job in organizing this whole function, and I think their efforts are here to be seen. Of course, the most important thing comes last. That is our heroes of this evening, the patients born with spina bifida and their parents. They have traveled all the way. I heard that one of our friends has driven from Bangalore here over 8 hours, and he's there. So because of them, we are all here, and I'm so thankful to all of you for attending this. And this will boost our morale to do more for these children in future. Finally, I also thank Mayor Vitabiotics and all our sponsors for making this event a grand event. Thank you. And most importantly, IAP, our friends from the IAP. I've just seen Dr. Sridhar now. So thank you so much. It's a very short notice again, but I think they have been our backbone, and they're supporting us in all our endeavors. Thank you so much, sir. Thank you all.
Thank you, ma'am. Just one request, ma'am. We met you last year for the World Breastfeeding Week celebrations, and with your kind permission, I'll request you to thank 3 doctors who have done exemplary work for the cause of breastfeeding. May I invite Dr. N.L. Sridhar, the Secretary, Dr. Sugunakar Reddy Garu, the President-elect, and Dr. Sri Salem, who has been the Central IAP EB member. And a bouquet, please. If we can have one bouquet. Ma'am, if you could please thank these 3 doctors who are representing the Indian Academy of Pediatrics. Sure, ma'am.
So, can I request all spina bifida individuals to please come ahead? Madam wants to meet all of them. Yeah, come on one side, this side. Shailesh, all spina bifida, come on one side. Call this side, this side. Not on screen. That's okay.
Maybe move the table back.
Is Akshada there? Akshada and
Dr. Sridhar to please join.
आप इधर आइए नेशनल एंथम प्लीज बोल दीजिए मैम अनाउंसमेंट कीजिए
I request everybody to kindly rise for the national anthem.
Dr. Sunkoj Bhaskar sir, please join us on stage.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे ग्राहे तव शुभ आशीष माहे गाहे तव जय गाथा जन जन मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you, everyone. We proceed to the academic session, and before that, we have Ms. Janvi Moody, who is a clinic counseling psychologist by profession, co-founder, trustee, and chairperson of the Spina Bifida Foundation, and managing director at Walk and Wheels Company NGO for able and disabled altogether. She's working at Aradhya G Medical Center as a counseling psychologist and remedial educator. Janvi Modi, may I request you to please join us on stage, and please can we have the SBF introduction and the video. Janvi, you've got 7 minutes. Thank you. Please join us on stage.
Ladies and gentlemen, can you sit down, all of you, so that I can also add on to what our governor has told us? मैं करूँ, आप नहीं करेंगे? मैं करूँ? आप ही करो. Slow, slow. कुछ ऐसा नहीं है मेरा coordinated नहीं है. आप खाली photos. Good evening. I think we had an excellent talk from our governor. She was awesome, the way she has elaborately told us about how awareness can help, how prevention can be helpful, and what a doctor or a person can do to, further on add on to the awareness campaign. I'm going to talk about our Mumbai chapter, the Maharashtra chapter, how we started with Dr. Santosh Karmarkar. May I have your attention so that I can talk more about how we all started someday and how Dr. Santosh Karmarkar directed us today where we've reached. Yeah, thank you. So I'm very proud and I give all my gratitude to Dr. Santosh Karmarkar for this remarkable journey of Spina Bifida Foundation. The Noble Endeavor was founded in 1997 in Wadia Hospital. This noble endeavor was started in 1997 in Wadia Hospital by visionary and the mentor and the true leader, Dr. Santosh Karmarkar. It is an honor to acknowledge his pivotal role as a pillar of strength, a guiding light, and a mentor extraordinary. Dr. Santosh Karmarkar's unwavering commitment to this cause has been nothing short of awe-inspiring. As a parent, I joined this mission when my daughter was born, recognizing the critical need to create an association that would extend a helping hand in the right direction for those affected by Spina Bifida. The uniqueness of our partnership with Dr. Santosh Karmarkar, medical expertise, and my role as a parent laid the foundation for Spina Bifida Foundation. It's like मैं चलता गया, करमारकर चलते गए और कारवा जुड़ता गया. So we had lot of other people's medical people, parents like Mr. Sudhakar, Snehal Deshpande, Dr. Taral Nagda, Dr. Alaric Arigis, and many more. Like today we have Dr. I'm sorry I forget the name, so I've just written your name, Dr. VVS Chandrasekharam and Dr. Khyati, and many more. Yeah, so a little more about what and how we have been, doing this journey. Together we have embarked this journey, not only to treat those in need, but to prevent this devastating effect altogether. Dr. Karmarkar's dedication and leadership have been the driving force behind our quest to provide support and prevention for every family across India. Our journey has not been without challenges, but the unwavering support we received from corporate social responsible people like Mayor Vita Biotics initiatives has been our wind beneath the wings. It allowed us to expand our outreach, reaching people in different corners of our beautiful nation. Our mission is now backed by 14 dedicated units, and we are incredibly fortunate to have 4 of these units led by dedicated teams of doctors. We also intend to increase more as people join our hands, medical field people join our hands. Our vision is to continue expanding our footprint, establishing more teams in every part of the country. But that's not all today. It has already been announced, my speech was before the governor comes, so I'm again going to repeat the same thing, that we are launching Telangana chapter today for Spina Bifida Foundation, and we are truly honored to be here in a vibrant city of Hyderabad, a place with rich history and a promising future. This new chapter represents an exciting opportunity to expand our outreach and extend our mission to even more families in need. We are grateful for the warm welcome and support we have received from this dynamic community, Hyderabad, which is diverse and dynamic population. Together with Dr. Santosh Karmarkar, Dr. VVS Chandrasekharam, Dr. Khyati, and other medical doctors over here, we will continue to hold hands and sail through our mission with determination, compassion, and unwavering hope. Our heartfelt thanks to go out to each and every one of you who have made this launch possible. As we embark on this new journey in Hyderabad, we carry with us the collective vision and dedication that has brought us this far. Together, we create a brighter, healthier future for children and families affected by Spina Bifida. Thank you, and let's begin this new chapter with the same passion and enthusiasm that has brought us this far. Thank you so much.
Thank you, ma'am. We now have two different perspectives on neural tube defects. One is on the embryo radiological checkpoints, an obstetrician's perspective, and a neonatologist perspective related to screening and diagnosis. So for the first talk, may I invite Dr. Jayashree Reddy to please chair the session. Dr. Jayashree. Over to you, ma'am. You may invite the speaker. Have a mic there? Do you have a mic there? Or would you like to come here? Mitra is the speaker.
Good evening, everybody. At the outset, let me thank the organizers for giving me this opportunity. Without further delay, shall I invite the first speaker, Dr. Mitravinda, fetal medicine consultant at Ankura Hospital, for her deliberation. Over to Dr. Mitravinda.
A very good evening, everybody. I'm very glad to be a part of this event today. Myself, Dr. Mitravinda. I'm a fetal medicine consultant working at Ankura Hospital's Banjara Hills. Today, we'll be talking about the neural tube defects, the journey in the womb. I'll be talking about the embryology, etiology, antenatal screening, prevention, management, and the recent advances in the neural tube defects. This is the overview picture of the new embryology, which is showing the defects which happens at the different levels of neurulation. The defect can be at the primary neurulation, at the stage of secondary neurulation, or post-neurulation defects. So the primary neurulation defects consist of craniorachis, anencephaly, open spina bifida. The defects at the level of secondary neurulation consists of closed spina bifida. Post-neurulation defects could be encephaloceles. This is the pictorial representation of the defects. So coming to the etiology of neural tube defects, the neural tube defects, majority of the defects are multifactorial inheritance, could be a single gene disorders, chromosomal abnormalities, usage of teratogens by the mother, and maternal insulin-dependent diabetes mellitus. These are the majority. There are so many other causes which leads to neural tube defects. Coming to the single gene disorders, the commonest one is the Meckel-Gruber syndrome, which consists of encephalocele, dysplastic kidneys, polydactyly, cleft palates. Chromosomal abnormalities, triploides and trisomies also contribute to the minor amount of neural tube defects. Teratogens, as already mentioned, like carbamazepine, valproin will cause neural tube defects. And the maternal insulin-dependent diabetes mellitus is also one of the major cause. Antenatal screening. How do we screen for the neural tube defects at the early stage? The screening will be by ultrasound and by biochemical screening. So NT scan is only visualization of NT and nasal bone at the NT scan. Is it sufficient? No. NT scan, there is so much more to diagnose at the level of NT scan. The antenatal diagnosis of many other major chromosomal abnormalities or the structural defects have improved over the years, and the screening for the neural tube defects starts at the very early stage. So, ISWOG has updated the guidelines for the first trimester screening and has given some guidelines where all these structures should be screened at the level of NT scan, which is performed at 11 weeks 6 days to 13 weeks 6 days. So this is general overview where ISWOG has postulated some anatomical structures that can be potentially visualized. As we are talking about neural tube defects, we will confine to the head and brain and spine today. So coming to the head and brain, what are the structures to be visualized at the NT scan? So calcification of the cranium, contour and shape of the cranium, two brain halves separated by the interhemispheric forks, choroid plexus almost filling lateral ventricles in their posterior two-thirds, which we call as a butterfly sign, thalami, brainstem, cerebral peduncles with aqueduct of Sylvius, intracranial translucency and cisterna magna. And in the spine, regular shape and continuity of the spine should be screened. And this is the reference. ISWOG has updated the guidelines. So coming to the antenatal screening, this is an ideal image mid-sagittal section of the fetal face where we take an NT measurement. This image here will give us much more information apart from NT. There are so many things we can diagnose only from this image. Coming to the normal fetus picture, where we can see so many structures, intracranial structures, thalamus, M represents mesencephalon, B is brainstem, MO is medulla oblongata, IT is intracranial translucency, which is nothing but the fourth ventricle, and NT is also measured in this image. Coming to the second image, where the IT, which is the fourth ventricle, is obliterated. We can't see that IT band in the abnormal picture. So when this is not seen, should raise the suspicion of some intracranial pathology going. So this picture represents the neural tube defects, open neural tube defect. So here there are so many markers which we assess at the first trimester screening for the early diagnosis of neural tube defects. This is one of the marker. Brainstem to brainstem occipital bone ratio is one of the markers which we calculate at the time of NT scan for the early diagnosis of neural tube defects. So the marking here, A to B, represents the brainstem, whereas B to C represents the brainstem to occipital bone. So the ratio should always be less than 1. Any ratio more than 1 should raise the suspicion of a neural tube defects early. And there is one more sign which has been described at the earlier, that means at the first trimester scan, which is a crash sign. Crash sign represents, as we can see, the pictorial representation of a car getting parked and there is a wall behind it. So that wall represents to the occipital bone, and the space between the wall and the car represents the arytenoid space. So when there is an open neural tube defect, because of the herniation of the brain contents, the structures in the brain will go and crash towards the occipital bone. The space is lost. So that gives us indication, some idea regarding some neural tube defects which is happening within the baby. So TVS scan should always be included in a routine screening program for any NT scan. TVS scan will give us much more information. The screening is very, the visualization of the fetus is more accurate, and this definitely, in case of any suspicion of a neural tube defect, TVS screening is definitely included. And coming to other signs where we can pick up the neural tube defects will be lemon sign. That is, as we can see here, the pinching effect of the occipital bone can be seen. This is because of the herniation of the intracranial structures. There could be hydrocephalus. There is one more sign which we described the neural tube defects at the antenatal screening is a banana sign, where because of the obliterated cisterna magna, the cerebellum is little curved and it takes the shape of the banana, so hence it is called as a banana sign. Last but not the least, the spine should be screened completely. All the segments of the spine should be covered in the screening. From the cranial, cervical to the sacral, all parts of the spine should be assessed along with the overlying skin. As we can see in the second picture, the skin is not intact. There is a cystic mass which is seen at the lumbosacral region. That could be a open neural tube defect. Apart from the antenatal ultrasound screening, there is one more screening called a biochemical screening available for the detection of the neural tube defects, where we include alpha-fetoprotein. Alpha-fetoprotein is a glycoprotein which is secreted from the yolk sac and the liver in the human body. So this protein can be evaluated at the early stage nowadays with the advancements of the biochemical screening. So instead of double marker, we can offer the mothers first trimester quadruple marker blood test, where we assess beta HCG, PAPA, AFP and PLGF. And coming to the second trimester, this quadruple marker can be performed at the second trimester, but the different variants are assessed, like beta HCG, unconjugated estriol, inhibin A, and AFP. So AFP, we calculate the measure of the AFP, we take it in the form of moms. Mom is a multiple of median. So we take 1 as a constant, and anything below or above, we interpret the results accordingly. So any levels more than 2.5 is should raise the suspicion of the defect. Always combine screening, ultrasound screening along with the biochemical screening will always yield a better detection rates. And apart from the neural tube defects, alpha fetoprotein is also raised in certain defects like ventral wall defects, omphalocele, gastrochisis, triploides, trisomies, and renal agenesis. So when assessing the alpha fetoprotein, the other conditions should also be kept in mind. What is the role of fetal MRI? Once the scan is done, so what is the role of fetal MRI in case of diagnosis of the antenatal diagnosis of the neural tube defects? First and foremost, ultrasound will detect most of the neural tube defects, open neural tube defects, as it is the primary modality of screening. So there are some challenges when we scan, like the ultrasound has relatively low spatial and tissue resolutions. In case of any oligohydramnias, maternal obesities, fetal malposition, advanced gestational age, and case of abdominal scar, it becomes very challenging to diagnose a defect. So in these conditions, we prefer a fetal MRI as an adjuvant to the ultrasound. So it provides more excellent soft tissue and spatial resolutions, multi-directional scanning, clear display of relationship between tissues, ideal for closed neural tube defects. Closed neural tube defects, MRI is the very ideal modality of, for the diagnosis of closed neural tube defects. So coming to the prevention, as this has already been talked in the previous sessions, like preconceptional use of folic acid. Folic acid is very important for the prevention of the neural tube defects. So the recommended dosage is 400 micrograms daily. It is always better to start 3 months prior to the conception. And studies claim that the decrease of prevalence of neural tube defects is 50 to 70% with the usage of folic acid. So recurrence risk and counseling. So now the mother comes to us, previous baby with neural tube defects. So they ask us what happens to the next pregnancy. How do we counsel such mothers? So according to the study, with one sibling having a neural tube defect, there is a chance of 15 to 30 per 1,000 live birth recurrence of the neural tube defect. 2 siblings with neural tube defect, 57% per 1,000 live births, and parent with neural tube defect, 11 per 1,000 live births is a recurrence rate. But this is based on the United States study. Coming to the management of neural tube defects, the mother carrying a neural tube defect baby, how do you counsel her? Where do you deliver that baby? What is the timing of delivery? And what is the mode of delivery? So the place of delivery, always a tertiary care center is an ideal place to deliver the baby, because multi-specialities are always better to take any decision or to further immediate treatment required for the baby. Mode of delivery. Mode of delivery depends upon the maternal and fetal condition at the time of delivery. And timing of delivery. There is no rule to deliver the baby early. It again depends on the maternal and fetal conditions, any comorbid conditions, and any fetal associated malformations. Depending on that, the mode of delivery and the timing of delivery are dependent. So what are the recent advances in the neural tube defects? So there is antenatal fetal surgery which is available for the neural tube defects. There is open surgery and the fetoscopic surgery, but of late fetoscopic surgeries has minimal side effects and the prognosis is good. So what is the rationale to start this in utero intervention? There is two-hit hypothesis which is proposed. That means the neural primary defect of the neural tube has already started when the baby is inside the womb. So when the baby continues till term or till delivery, the exposure of the exposed neural tube to the amniotic fluid will causes further damage to the neural tube defect. That's when they thought of this MOMS trial, that is management of myelomeningocele study, conducted in 2003 at 3 maternal and fetal centers in United States. They've compared the results of antenatal versus postnatal surgical correction. Now they offer this procedure as a standard of care. So this is just a diagrammatic representation of the fetoscopic surgery here. So they've compared the outcomes at 12 months and 30 months post-delivery. So here outcomes, infant outcomes at 12 months post this trial, 40% prenatal surgery group had no placements of shunts, whereas 82% postnatal group had placements of shunts. And hindbrain herniation, 64%, only 64% in the prenatal surgery had hindbrain herniation, whereas the postnatal surgery group, 96% had the hindbrain herniation. And brainstem kinking, 20% fetuses, 20% infants in the prenatal surgery group had did not have any brainstem kinking, whereas 48% in the post-surgery group. And outcomes of children at 30 months, there are so many factors. I'm just highlighting the walking independently on examination. 42% were walking independently in the prenatal surgery group, whereas 21% in the postnatal surgery group were walking independently. So after this trial, they have concluded that the benefits of the prenatal repair lowers the rate of hydrocephalus and decreases the need for brain shunts, improves leg function and chances of independent ambulation, reduced risk of progressive damage to the spinal cord and nerves caused by the exposure to the amniotic fluid. So this is the reference, a randomized trial of prenatal versus postnatal repair of myelomeningocele. This is the reference for this surgical outcomes. Thank you.
Thank you. May I now request Dr. Chandrasekaram sir to please hand over a memento to the chairperson and the speaker to please join us on stage. Can we have the memento, please? Memento. So that was a very interesting embryological obstetrician's perspective, and chairperson and the speaker. Chairperson Dr. Jayashree Reddy and speaker Dr. Mitra. Ma'am, come forward. So next we look at the neonatal perspective. To chair this session and the next session as well, may I invite on stage the President-elect of IAP Twin Cities Branch, Dr. Sugnakar Reddy Garu, along with Dr. N.L. Sridhar, the Dynamic Secretary of IAP Twin Cities Branch. Request both of you to please chair the session and invite the next speaker. Thank you. 6 minutes for the talk.
Hello. Good evening. Good evening. The next session is going to be a neonatal aspect of the neural tube defects by Dr. Srikanth Gona, neonatologist. And this today's program, which was organized by the Spina Bifida Foundation, is an excellent program. I have not seen any such program for the last 30 years. We were seeing many patients since our postgraduate days. So at that time, initially there was, pediatric surgeon used to say that don't send the referral to the pediatric surgeon for neural tube defects. You just counsel the patient and send home. Even when with the difficulty we write a referral and they used to admit and they used to send back. And with very difficulty they used to do the surgery at that time. Now the results are very good. And associated problems like paraplegia and bowel and bladder difficulties have to be tackled by the pediatricians as well as the pediatric surgeons. So may I invite Dr. Srikanth Gona onto the dais.
Sir, Srikanth Kona is a senior most consultant neonatologist and pediatrician. And coming from IAP TCB, spoken to the president-elect. From next year onwards, we'll definitely support this Spina Bifida Association from IAP TCB. This is an academy body. So for the social service, we'll be the first person to support anyone. And definitely, I assure you, sir, definitely we'll come forward. Whatever the things you want, definitely with Ankura, we'll definitely collaborate and do in a bigger way than this. Thank you. And the most commonest birth defect is neural tube defect. So once happen. But after that, what? Screening and diagnosis are most important, and the solution to the patient. That will be dealt by our Srikanth Kona. Please, Srikanth, go ahead.
Thank you, sir. Good evening. I welcome you all. I've been told 7 minutes. Now it's gone to 6 minutes. So I'll try to stick to 6 minutes as much as possible. So before going that, I would like to have a case scenario to start with, probably that give more practical inputs to us as audience. So we had this 3-year-old girl, comes from a decent educated family, just joined the preschool. There's no major health issues in the last 3 years. Recurrent mild cough and cold, often went to pediatrician and got treated with antibacterial symptomatic treatment. Now, unfortunately, at around 3 years, 9 months, this child had developed mild progressive paraparesis, the weakness of lower limbs. Taken to private hospital in the city, and of course, we have a neurologist consult, pediatrician consult, all consults have been done, and the provisional diagnosis made as post-viral transverse myelitis, which commonly we see in case of progressive paraparesis, a 3-year-old child. Child came to us after 2 weeks of hospital, private hospital, and when she came to us, she was almost paraparetic. Now, on examination, what we found is the child had mixed spastic paralysis, grade 1/5 in thighs and 0/5 in the lower limbs. This reduced anal tone. And the most interesting finding what we saw was this was missed. Now, the point of taking this case, we have one more. When we got the MRI done, I think it don't have a point. You can see intramedullary abscess forming in the sagittal sessions. You can see the edema extending up to cervical column there with the dermal sinus opening into the skin. This child, of course, went to intermediate surgery for drainage of abscess on antibiotics. Once infection under control, child was fine. It was taken for detethering at 6 months of post-surgical drainage. Child is back to school after 1 year of the whole process. The point of taking this topic is examination is important. You just can't rely upon the symptoms, your lower limb findings without examining the spine. One more short case here. These 2 brothers, 7 and 5 years old, both had the skin lesions, epilepsy, and capsular spots, typical triad of tuberous sclerosis, well and fine. The younger one developed lower limb weakness and blood disturbance at around 6 years of age. And what was missed? A dermal sinus at the back. Now, this is one of the interesting articles what we found. The congenital spinal dermal sinus is the most commonly misinterpreted or missed diagnosis in case of neural tube defects. And this is an article published in 2006. You can see the doctors there, most common condition what the diagnosis, transverse myelitis. Of course, they end up with antibiotics. But what we fail to do is to pick up the subtle signs what the child has in the back. This is very obvious. I don't think as a neonatologist I need to really search for this because staring at your eyes, we just a link between a gynecologist and a pediatric surgeon. The moment you see that, call a pediatric surgeon, get MR done, look for the abnormalities and take it for surgery. But what is more important is the lower two conditions. Something which got a dorsal subcutaneous mass, which is obvious clinically, you don't need big brains to diagnose it. What is important is look for the lesions without dorsal subcutaneous mass, where probably you don't have a significant skin findings at the back. And the most common condition what we see is occult spinal dysraphism. The findings what you see in the skin, maybe a little bit of hair, swelling of spinal lipoma, pit in the dermal sinus, skin discoloration, deviated gluteal force, and the list goes on. And this subtle manifestation what we see at the back. You can't afford to miss these things. The last corner slide is small pit. It might just look like a small pit, but what underlying is more important for us. So my job is to pick up these subtle signs, inform the surgeon, get the right diagnosis, and take the child to the right and appropriate treatment at the right time. The most common dilemma, what we feel as neonatologists is, we see multiple dimples at the back. The most common is sacral dimple, which is a very mild variant, seen in 4% general population, has no underlying spinal defects. But how are you going to differentiate with dermal sinus? If you point just clinically, if it's more than 2.5 centimeters above the anal opening, more than 5 mm, directed superiorly, we are dealing with something beneath it. Don't take it lightly. The right slide, you can see the top one is a dermal sinus, which is pathological. The bottom one, what you see is a sacral dimple, which is a normal variant. And of course, clinical examination is a must. As a neonatologist, when you see any kind of a lesion at the back, always look for your anal sphincter, the tone, as well as your urinary symptoms. Diagnosis-wise, X-ray doesn't give much of a picture for us, but if you take an X-ray for any other reason, for RDS or from gut pathology, always make sure you look at the spine. These are just incidental findings where you see in hemivertebra and split vertebra there in the newborn X-rays. But again, it's not going to give a clear picture. Role of ultrasound is limited in the sense, if you have clear-cut mass, MR is a diagnostic of choice. If you're in a dilemma where you have small capillary spots, hemangioma, some pits here and there, rather than subjecting the child to MR and anesthesia, always have a bedside ultrasound. It's highly sensitive, highly specific, more so for tethered cord and caudal regression syndromes. At the same time, beware of the normal variants that ultrasound can pick it up and probably misguide you. Before finishing my talk, I think prevention is better than cure, but unfortunately, 70% of the world is not taking active measures to prevent your neural tube defects. There are a few studies here, I think I'll just skip through. I think we've already spoke about it. The Food Safety Standard Authority of India has reduced your fortification of B12 and folic acid in 2018 because of iron complications from almost to 90% what is required. Probably we need to look into that. So finally, it's a missed opportunity. We can't afford to miss a baby. And probably in case you miss it, you're going to see this baby after 3 to 4 years landing up in emergency with paraparesis. Few studies in India, not many. Look at the folate insufficiency. Haryana is around 78%, South India is around 80%, staggering Sangli, Maharashtra is 95%. This was done in 2019. I think with that, I'm done. Thank you very much.
Excellent talk.
Painting. I just worried about the painting. This
Can just put the slide back.
2 years back, I don't know how to even hold a brush, but the point here is, if you're committed, you want to do something, take it as a challenge, you can do it. The point of having this whole CME, the meetings is awareness, spread awareness, start from your own family, your colleagues, your friends. If you can think, you can do it, of course. Thank you very much.
Excellent talk, Srikanth. A good message, bedside ultrasound, and gold standard MRI. All cases doesn't need any backside lesions, skin lesions may not be there. In those cases, one case, first case scenario, 2.5 years old. There's a beautiful case. We shouldn't miss that. Doing MRI, we can find the spinal tube defects and we can correct it. And good to see that child had a normal walk and gone for school. Excellent cases, scenarios, Srikanth. Excellent presentation.
Next talk is by Dr. Santosh Karmarkar from Senior Consultant Pediatric Surgeon from Leelavati Hospital, Mumbai. And he has many publications in leading journals. He is a visiting fellow for UK, USA, and visiting professor for Italy and Geneva. He was the past secretary of Indian Association of Pediatric Surgeons. He is the founder trustee of the Spina Bifida Foundation since 1997. May I invite Dr. Santosh Karmakar for the next talk. The topic is neural tube defects and overview.
Can we have the slides? Okay, so before I start my short talk, I'll try and make it shorter than I thought I would. Can I ask how many people in the audience are doctors? Please raise your hands. Okay, quite a few. Because accordingly, I can be a little more technical because it's a mixed audience, non-doctors as well as doctors. Right. So I think some of the previous speakers and after me, Dr. Khyati, will speak about a lot of technical issues, surgical technique, and a lot of science of managing neural tube defects. As Dr. Kona spoke about screening. So my job, as I see it, is not to talk too much about techniques and surgeries. We have great experts in Hyderabad like Dr. VVS, Dr. Mehul, and a whole lot of people. So that's not a problem. It's the availability of expertise is not a problem. So I'm going to dwell very briefly in this talk on what I feel are the important issues which affect outcomes of neural tube defects in India. Okay, and one of the most important things which probably matters when we are talking of managing a child born with spina bifida is our attitude. Our attitudes as individuals, as individual doctors, our attitude as a society, and our attitude as a country. I mean, unless the country decides to strengthen the public health delivery system, many outcomes may not improve. How does this go ahead? Okay, fine. So as we all can imagine, serious birth defects like neural tube defects cause a great socio-economic burden on individuals, families, societies. The children born with these defects lead a poor quality of life, and long-term rehabilitation is also very, very costly. And especially in a country like India, where there is very little help from the state, it is difficult to foresee a situation in the near future where all these children will get the best possible medical care and rehabilitation. Because the healthcare scenario, as I said, is extremely fragmented, extremely inadequate, and overwhelmingly privatized. I mean, in that kind of a system, to enable these children to get the complete care they need is difficult. So we are fighting against a lot of odds. I remember a patient of mine from Goa, born in Mumbai, and we closed the back and put a shunt, and then the parents migrated to UK, to London. Father was a chef. He got a job there. And within 3 weeks of the family reaching London, the mother calls me and says, "Sir, it is so good here." Within 3 weeks, they get a call from the NHS, and they get a community nurse visit their house because they have found out that a spina bifida child has come and is living here. And then the entire treatment, I mean, it's home delivered. So, you can't foresee that thing happening here so soon. So our attitudes towards these things need to change. So if we talk of attitudes, what affects, what are the factors on which our attitudes depend, or how are they made? So a lot of moral, ethical, religious beliefs and convictions may come in the picture when we are talking of a fetus with a birth defect like a neural tube defect. For example, if you are in Poland, or if you are in Ireland, or maybe even in Japan, with very strong religious beliefs, a fetus with an NTD has to carry on the pregnancy, and abortion is out of question. Especially if you are a religious person in that country, then it has to be You know, so these places, the highest number of fetal surgeries are being done in countries like Poland on children, on fetuses with NTDs. On the other hand, if you look at a country like Netherlands, which is not very far away from Poland and Ireland, the attitude is completely different. There is one, I don't know how many of you know of the Groningen Protocol, which suggested or which allows children up to the age of 3 years born with serious birth defects to be, it's unfortunate, but to be killed with active euthanasia. So this is the other extreme, and I was surprised that about 5 years ago, this protocol in Netherlands extended this permission to the age of 7 years. Can you believe that there's a country which allows euthanasia, active euthanasia, for children with birth defects, serious birth defects like NTDs, which come. So these attitudes, I think, matter a lot, and some are grossly wrong, and Netherlands is a crazy country. I mean, to have a protocol which allows this. Yeah, it also allows marijuana to be sold by vending machines. So it's a ridiculous place to be in. Thankfully, India is not going there. Also, I think a lot of doctors here feel that when they see a baby born with a neural tube defect, it's a gone case. And many doctors across India feel that this is a lost case, nothing will happen, don't do anything. So our knowledge about the quality of life that these children can actually lead is also important in deciding our attitude about how we'll treat them. And in today's program, you have seen some of the Spina Bifida individuals who have got the necessary treatment from birth and are doing so well. So that's also a problem which affects attitudes in this country. And again, because of lack of awareness, lack of opportunity to see good outcomes, so chapters like the Telangana chapter and other places are a kind of way in which we can make doctors and the medical fraternity aware of what positive outcomes can be. Again, even if you are aware, sometimes or many a times, there is not easy access to good expert care. They don't reach centers where a bladder augmentation is done. So that's another thing which may deter proper management. And of course, proper social rehabilitation, again, is something which is lacking. So all these things affect the outcomes of treating children with NTDs. So one of the, and again, these outcomes sometimes also social biases. As we all know, the girl child is looked down upon. So many years back, one of my emotional connects with Spina Bifida was when, as a resident doctor in KEM Hospital in Mumbai, a child was brought in by a poor farmer family. And when I took the history and asked the name, this mother and father said her name is Nakoshi, which means unwanted. So I said, no, but I'm asking her official name. I know you don't want her, but she said, no, she is officially named Nakoshi so-and-so. So if you have that kind of a society, then you can imagine what can be. And then to my surprise, some years back, the government of Maharashtra brought together all the Nakoshis of Maharashtra and did a big renaming ceremony to change their names from unwanted to proper names. And these girls and ladies were from the age of a couple of years till the age of 56. The eldest was a 56-year-old called Nakoshi. Then I realized that there are these Nakoshis throughout India. They are not called Nakoshi, they may be same meaning unwanted, but in different languages across this country. So I think that's something we need to completely get rid of. As speakers have mentioned, the problem of neural tube defects is enormous. 4 per 1,000, that means it translates to about 25,000 pregnancies affected with neural tube defect. And shockingly, these should have been prevented and are prevented, but no awareness. As we discussed some time back, there's very, very little awareness. What can happen if a fetus is diagnosed with an NTD? One, it may be terminated by antenatal diagnosis in time. Second, the fetus may undergo fetal surgery if it's available. It is available in many parts of the world, not yet in India, but maybe it may become available soon. Or a large number of them are stillborn. So the natural history of maybe about 50% of fetuses with NTDs may be that they result in stillbirth. And this is a recent WHO study being done in Southeast Asia, where they found that a large number of stillbirths are actually due to NTDs. And lastly, of course, you can have a fetus who goes on to full term and is born with a neural tube defect. So if you see a child with a spina bifida, a newborn, as we said, attitudes do matter. If you see a fetus with NTD, what do you advise? Do you advise MTP? Do you advise carry on with pregnancy? Do you think the glass is half full? Do you think the glass is half empty? And who decides? Should it be the doctor? Should it be the family? Or what? Should there be a board in each hospital of few doctors and parents who decides? Can we prognosticate antenatally whether this child will be able to walk or this child will have a serious disability? So I think all these factors are important, and I'll talk a little bit about how my life has become easier as far as counseling families antenatally. But this is a big issue about how to counsel, what to counsel. Maybe after today's program, many of you might counsel differently than you probably were before this meeting. So before you decide about prognosis and disability, there's one statement which I want to make, which is very, very important. Almost all these children with NTDs should have a normal IQ and a normal mental development, because their brains are completely normal. And if they are treated properly in time, if a shunt is placed within the first year of life, if the back is closed, I think almost all of them are capable of becoming pediatric surgeons or neurosurgeons or pediatricians, or of course, sportsmen, singers, whatever. So I think that is the silver lining to this so-called dark cloud. I say so-called because I don't think it's a dark cloud. And here are some examples of some more of these star performers who have undergone several surgeries since birth, but are leading completely independent and productive lives. And here is Parth, one of our patients, undergone his back closure, several VP shunt revisions, incontinence procedures. He can't walk, but he's a gold medalist swimmer. And he won a sports award recently at the hands of our XXX. I don't know how many CMs have changed after that, but this was some years back. Another girl with spina bifida, wheelchair dependent, and a great inspirational speaker. She comes to many of our meetings and gives great talks. So Khushi was called by this Saregamapa program to come as a motivational speaker to all the participants and people in that program. Here are two young ladies born with spina bifida, with incontinence, undergone all the incontinence operations, and recently during COVID, both of them got married and both of them have sweet children. Both of them underwent cesarean sections. One was in Aurangabad, one was in Mumbai, and this was after a bladder augmentation. So the obstetrician was a little worried about whether the Mitrofanov will come in the way of the cesarean, and she called us to be there during the cesarean operation. So they have great futures, and the glass is certainly not just half full, but it can be completely full if one wants. Another example of the previous president of the International Federation, Dr. Margot Whiteford. She is a pediatric geneticist from Glasgow, and she is one of the most fashionable ladies I've met. Every dress that she stitches, she has a matching wheelchair cover. So, and she doesn't like anybody to help her with wheelchair, even if it's an incline. So these are great people. I mean, they are inspirations to us rather than the reverse. So you may think, oh, that's possible in UK, it's not. But here is a similar individual from Chennai with spina bifida, again a great person, and works in a big position in an IT company in Chennai, got married with a colleague who was working with her, wheelchair dependent, and has not one but now has 2 children. And she goes on the fashion ramp. She's called to participate in beauty pageants in fashion ramps. The first lady neurosurgeon, head of department of neurosurgery in US, is spina bifida hydrocephalus individual. So, as I was saying, the aim of my little talk here is to change the outlook towards looking at children with spina bifida. For me, this journey has been really exciting. As far as I was telling you how I counsel a family who comes with a fetus with NTD. Earlier, we used to tell them, give them all the pros and cons, talk to them about the disability, the paralysis of lower limbs, incontinence, and then they used to go home and come and meet me after a few days and say they don't want to carry on with the pregnancy. That was then, which was maybe 15, 20 years ago. But now, I just explain the same things to them, but tell them, before you decide, please go and meet this family in Hyderabad, or the other family in Mumbai, or a family in Chennai, or Srinagar. Everywhere there are families with children who are doing so well. And it's unbelievable that 15, 20 years later, 95% of the families come back and tell me they want to go ahead with the pregnancy. So this is unbelievable. So I think it's just that their eyes have not seen what is possible. If they just see it, all of them want to carry on with pregnancy. These children require a lot of operations, which require quite a bit of expertise, and these are difficult for people to access, to reach centers which do it, and that is why the foundation is trying to spread its footprint across India and develop a few centers of excellence in each region. Again, a very important thing when we talk of, long-term outcome of spina bifida. You can get a child, they counsel them, they want to go ahead with pregnancy, with treatment, the back is closed, the VP shunt is done, but then what? Then they go from one doctor to another, and this condition, as we all know, requires multidisciplinary care. You require several people to treat these patients. So it's like an orchestra where you have all these musicians who have to play the right tune at the right time to see that the outcome of this child is like Mahi or like Amar or these others. And so I want to ask one question to some doctors here. Who do you think is the most important person in this? Of all these players who play their tune, who do you think is the most important? Maybe we can ask VVS to start with. Okay, he says the Spina Bifida support group. Maybe we can have one or two quick answers. Doctors, not non-doctors. Yes. Oh, you think the VP shunt is the most crucial? Okay. Okay, so I think the most important person in this orchestra who really can decide how the tune and how the symphony is played has to be this. Okay, the conductor. Now this conductor can be anyone. It can be the VP shunt wala, it can be the incontinence treatment wala, it can be the pediatrician, any one of all those. But one of them has to play the role of the conductor. So the conductor is somebody who knows how to play each instrument a little bit. He is not a master, but he knows the pros and cons of each instrument, and when the tune is to be played by the pianist, when it is to be played by the saxophone person, and when you have to tell the drummer that please keep quiet. Okay, don't play it just now. So the most crucial is, I think, the conductor. And what we see today is we have all the experts, all the musicians, but nobody wants to play the conductor. And I see myself as a conductor of this big orchestra, and maybe on the side also being able to play a few instruments. Outcomes also depend on other factors where the role of the foundation, the support group comes in the picture, such as schooling, rehabilitation, psychosexual counseling. We are now seeing our children growing up and reaching adolescence, adulthood, and having a lot of psychological, psychosexual questions which nobody has asked them and they don't have a platform to answer. So I hope I have already exceeded my time, but I'm still going to take a couple of minutes more with your permission. Some years back, in a Spina Bifida meeting in Turkey, I was sitting with about 25, 30 patients from the age of teenage to about 20 plus, and with one Turkish urologist. And it was a discussion with them, and this Turkish urologist asked the Spina Bifida group, how many of you are sexually active? So in that room, everyone except me and the Turkish doctor raised their hand. So I was surprised. That's the time I came back and I said, हम तो इसका सोचते ही नहीं हैं about those sexual needs, sexual thoughts, guidance. And these people, these children, these adolescents in Istanbul were some of them on wheelchair with crutches, and they were all sexually active. Then we did a few webinars with adolescents. So we have a adolescents group now, and they are quite well connected with the international youth group, and they are have good sessions. So all this thing also will be extended to the Telangana chapter. I will run through this. The previous speaker spoke about fetal surgery, but we were on the verge of starting fetal surgery. Before COVID, I visited this center in Poland, and we thought we would do it quickly, but then because of COVID, our plans got delayed. And this lady in Katowice, Poland, does the maximum number of fetal MMC repairs in the world. And we have now called her in March to come to Mumbai, and we'll have a meeting to discuss various aspects of fetal surgery. These are some pictures of actual fetal surgery being done, and I was quite privileged to be a part of this team, not for a long time, just a week. So this is the back lesion. This is the meningomyelocele bubble, which has been delivered through the hysterotomy, and the repair which is done is exactly the same as we would do postnatally. Okay, so that was about fetal surgery. And lastly, a few slides, again, to emphasize that to really have good outcomes, we need support groups, we need foundations, and the foundation is now active in many parts of this country. We have Ravina Tandon as a brand ambassador of the foundation. But what is most important, if somebody asks me, what is most important today as far as neural tube defects is concerned in India, then I would say it's probably the need, the acute, the immediate, urgent need to start a national awareness campaign about spina bifida and its prevention. Because, I mean, I think no woman in this country knows the fact that firstly there is an anomaly like this, and secondly that she has to take 400 micrograms of folic acid few months before conception. I mean, if you ask 100 ladies, I would be surprised if even one of them knows this, whether it's in Hyderabad or Mumbai or any small town. So I think this is top priority. The foundation is very actively working towards this, and that's why I put in a little word with the governor here, thinking she might take some lead in Telangana. Because we keep getting calls on our helpline from children. These are all actual patients who have called us in the last few months with children born with spina bifida, and they don't know what to do. Nobody has guided them about counseling and treatment. And every week we get about 2 or 3 calls like this. Luckily, not just from newborns, but now even from teenagers and girls who are ladies who are 20, 22-year-old. All of them have a mobile. From somewhere, or if they Google, they found find out about the foundation and they just call us. So I think which is a good sign, but to be able to do everything that all of them need is we can't do alone. And that's why the chapters of the foundation need to play a bigger role. So with that, I just end my talk, and sorry if I've exceeded my time, but thank you for a quiet, patient listening. Thank you very much.
Excellent talk, sir, by Dr. Santosh Karmarkar. He had his experience speaks a lot now. And as you said, sir, neural tube defects in the second trimester, MTP or termination. Really, it's a painful thing, sir, but still counseling, as you advised, 90% to 95% cases are continuing their pregnancy. It's a definitely encouragement to the gynecologist also. But still, I say, antenatally, the treatment is better than these all the problems. Prevention. Thank you, one and all.
Thank you. May I invite the two speakers to please join on stage, Dr. Srikanth and Dr. Santosh. And calling on stage Dr. Mehul Shah to please hand over a token of appreciation to the chairpersons and the speakers. Mehul, please. To the two speakers, Dr. Santosh. Dr. Mehul to please hand over a token of appreciation to the two chairpersons. Thank you, Dr. Sridhar and Dr. Sugnakar. I know you have been to 3 other programs. Thank you for sparing your time and joining us here today. We move on to the next talk. We have seen the embryology, the obstetrician's perspective, and then the neonatologist perspective, and then an overview of the life of neural tube defects. Now let us look at the surgical aspects. And to chair the session, I invite on stage Dr. Narayana, KVS Narayana Garu, the Secretary of TS IAPS, sir here, and Dr. K. Nagarjuna, Head of the Department Pediatric Surgery at Gandhi Hospital. May I now request their place, Dr. VVS sir, to please chair the session, and then invite the speaker, Dr. Khyati, and take the session forward.
A very good evening. Dr. Khyati will now cover briefly about the various surgical aspects of spina bifida, including the spinal surgery and also the bowel and bladder incontinence treatment techniques.
Good evening, everyone. So my topic today is the surgical aspects of neural tube defects. Okay, so the important aspects I'll be covering are the closure of primary neural tube defect, open and closed neural tube defects, surgeries for hydrocephalus, neurogenic bladder, and neurogenic bowel management. So one important note before we start about surgeries, pre-op care. These children will have to be nursed in prone or lateral position, and the lesion has to be covered with a saline-soaked sterile gauze, and if possible, a plastic wrap over that to prevent heat loss. It's very important to assess the neurological status before we proceed with surgery, and also to counsel and prepare the family about the post-operative risks, need for further surgery, rehabilitation, and follow-up. The surgery has to be done as early as possible, preferably within 24 to 72 hours after birth. This picture shows a ruptured MMC which was referred from the periphery. Here we can see that there's a catgut knot around the lesion, probably to prevent its leak. But normally what we are supposed to do is refer such children as early as possible to a pediatric surgical expertise, cover the lesion with a sterile saline gauze, and once the child reaches the operative center, we give them the meningitic dose of antibiotics for 48 hours, improve the fluid status of the baby, and then take them up for surgery. So the open and closed neural tube defects were already covered. So principles of closure, we basically have to close the back. So open neural tube defects, the first step would be to separate the neural placode and to create a neural tube. That will be covered by a watertight closure of dura, followed by a tension-free closure of paraspinal muscles fascia, followed by skin closure. Various techniques, flaps, etc. are used for this particular procedure. Then coming to closed neural tube defects. So the important thing about closed neural tube defects, as mentioned by Shrikant Kona sir, was identifying them. Now the problem why surgery is required and timely surgery is required is, so at birth, the tip of the lower end of the spinal cord is at L3 level. Now as the child grows, at about the second year of life, it reaches its adult position, which is at the level of L1 vertebra. Now in closed neural tube defects, several pathologic fibrous cord or a fatty phylum or a dermal sinus pit or a lipomatous lesion can tether the cord, preventing its ascent. That can lead to neuropraxia and manifestations of paraplegia, neurogenic bowel and bladder. So in such patients, clinical examination, identifying that there's a closed neural tube defect and timely operating them will release the tether, allow the ascent of the spinal cord and prevent the neuropraxia. So in these cases, we usually use EMG tracing to identify or differentiate between the functional nerves and the pathologic tissue, which needs excision or release. Next, hydrocephalus is the most prevalent after the primary back closure, where it's around 80 to 90% of neural tube defects have hydrocephalus. So first thing preoperatively which we check in these babies before proceeding to surgery is clinically assess for signs like stridor, swallowing dysfunction, central apnea, and vomitings to see if there is hydrocephalus. Do an ultrasound cranium or CT brain for an older child. Rule out hydrocephalus. If there is hydrocephalus, first we need to act on the hydrocephalus. A VP shunt has to be done prior to closure of the neural tube defect. Now, suppose there is no hydrocephalus in the pre-op period, then post-operatively, we will take a baseline cranial ultrasound in the post-op period or monitor the clinical signs to watch for the appearance of hydrocephalus, and accordingly, if it appears, we operate and go ahead with a VP shunt. So one of the less known, less spoken things about the surgical aspects of spina bifida are managing neurogenic bowel and bladder. So I'd like to focus a little more on that. So neurogenic bladders, the issue with these patients is bladder function can be divided into two. One is storage and the second is voiding. So the issues these children can have with storage is they can have hostile bladders. That is, urine is stored but at very high pressures. Sometimes the detrusor is overactive, so it produces immense pressures which can reflux the urine into the kidneys, producing renal damage and loss of function. Second part is the voiding issues. So either they have a loose, lax sphincter because of which they keep leaking, or sometimes they can have a dyssynergic sphincter wherein it doesn't sink or it doesn't relax when the detrusor contracts. So ultrasound and urodynamics are pertinent in following up these patients. So we do a baseline urodynamics at 3 months after the surgery, once the spinal shock, the child recovers from the spinal shock, and then we follow it up with annual UDS till 5 years. So what we've noticed in these children is 3 types of voiding. A are the lucky children or lucky people. So here we can see that there is a synchrony when the bladder contracts, the sphincter relaxes and the child voids, the pressures are okay. B is the second lucky group, wherein the detrusor activity is absent, sphincter activity is also absent. So they leak, but at least their upper tracts are protected. Now the C and D groups are the dangerous ones. So what we see in the C and D groups are the detrusor is contracting, but simultaneously the sphincter is also contracting. So now there's urine it's being propelled against the sphincter, but the sphincter is not opening. So that leads to generation of high pressures, which can damage the upper tracts. So in Ankura, we routinely do urodynamic studies as baseline to follow up, to understand the function of the bladder and accordingly treat the patients. So here, this is an example of an overactive detrusor with multiple uninhibited detrusor contractions and a high pressure bladder. This is the dyssynchrony which we can see where the EMG tracing shows no contraction, no relaxation of the sphincter, because of which the uroflow is not good. It's like a staccato pattern. It's the bladder is not able to push the urine because the opening is closed. We also combine fluoroscopy in some cases to see if there is a VUR or an open bladder neck, which helps us plan the further management. So management strategies, as I said, the two issues with bladder function would be 1, storage, 2, voiding. So if the bladder is unnecessarily storing more, pressures are high, and upper tract reflux and upper tract damage is happening, we need to put them on anticholinergics, reduce the bladder pressures, reduce the overactivity, and try to reduce the hostileness of the bladder. 2, if there's too much of urine residing in the bladder and not getting emptied properly, that is voiding issues, then CIC, that is clean intermittent catheterization for emptying the bladder. Play the video. We also offer intravesical Botox injection, which provides a anticholinergic effect for almost 3 to 6 months. In some patients, some female patients or some patients with obesity or some non-compliant patients, we offer mitrofenov, which is a continent catheterizable channel for CIC. Management of incontinence, there are several techniques to increase the bladder resistance. It can be a facial sling from the rectus sheath, or it can be bladder neck reconstructive surgeries like the Young D's Ledbetter procedure. Or in some cases, we need to do a bladder neck reconfiguration, increase the bladder capacity with an augment. In this picture, this is an ileocystoplasty where a segment of ileum is being used to increase the capacity of the bladder. We combined it with a mitrofenov with the appendix. Coming to fecal incontinence, initially the management is started with dietary changes and retrograde enemas, but the best way to keep them dry for longer periods would be a Malone antegrade continent enema, wherein we create a channel using either an appendix if available or a part of the intestine, and we give the enemas in an antegrade fashion. Usually the children or the adults stay dry for a period anywhere between 12 hours to 2 days also with this procedure. I'd like to end my talk with some pictures of mitrofenov, that is a continent channel at the umbilicus, and a mace procedure, which is on the left side. So what I want to show with these procedures is, these children will be able to be dry, they'll be socially available to go to school, college, pursue their hobbies, careers, with certain procedures which are actually cosmetically acceptable also. So I just wanted to pull away the stigma by showing some of the cosmetic results which mitrofenov and mace procedures can produce. Thank you.
Thank you, Khyati. I think you covered all important aspects very briefly. Thank you.
Okay. We'll continue with our program. Now we have our sponsors, Mayor Vita Biotics, Mr. Kranti, Mayor Vita Biotics. Yeah. They'd like to talk about their products.
Hello everyone. In the world where diversity is celebrated, there is an extraordinary group of individuals who inspire us with their resilience, strength and unwavering spirit. October 25th is marked as a World Spina Bifida and Hydrocephalus Day, a day dedicated to raise awareness, promoting understanding and supporting those living with spina bifida. In India, 4 out of 1,000 children are born with spina bifida. This can be avoided with awareness on taking appropriate folic acid supplementation along with balanced micronutrients before and during pregnancy. To strengthen the awareness and support this noble cause, Mayor Vitabiotics is proudly associated with Spina Bifida Foundation India, founded by Dr. Santosh Karmarkar. Let us stand together not just on this special day, but every day to honor the strength, resilience and limitless potential of those living with spina bifida. Together, we can create a world where everyone thrives regardless of their differences. Thank you.
The desire to make a difference in patients' lives led to the genesis of Advanced MedTech Solutions. We are dedicated to advancing patient care by manufacturing value-driven medical device technologies to serve the needs of more patients and healthcare professionals. We provide healthcare professionals with the right tools and enable them to do what they do best. The heart of the mission at AMS is to impact the global patient by optimizing patient outcomes through quality, affordability, and accessibility. AMS was founded in 2013 by an elite team of respected industry leaders and visionaries who understand the challenges of the current healthcare environment. Our new state-of-the-art facility is equipped to manufacture a cutting-edge class of medical devices that meet the most stringent global standards. This eco-friendly manufacturing plant is singular in design and distinguished in efficiency. It serves as a technological and educational hub focused on the medical science fields of surgery and interventional cardiology, reaching out to healthcare professionals and providers around the world. AMS offers a compelling choice with a corporate and social responsibility founded on advancing the way we care for generations to come.
Next, we have some performances by Spina Bifida individuals. We have Mahi Rude, who is going to be singing some more for us. Mahi, can you please come on the stage?
Hi everyone. Hello. Hi. తెలుసా Thank you. Sorry for the wrong words, okay? By the way, the first song was in Tamil, the second one was in Malayalam and Hindi, and the third was in Telugu. Thank you.
Thank you, Mahi. That was wonderful. And a special thanks to the Telugu versions. Next, we have Akshadal, another super talented individual who's going to perform for us, and she is from Hyderabad.
Jum num ta jum ta dhalam kutak tak da da gida ta jum taka jum ta takita ta da ta jum gida ta tanum ta rum ta takita ta da gida ta tarita ta dhanata ta runata ta binista ta da jum tanum ta rum tagadim takita dim ta tarigida ta jum dim da ta jum nam da ta jum tam takita dana ta tarigida dim ta tarigida ta jum dim takita jum jum takita jum ta jum takita ta jum tarigida jum tarista ta dana tarista ta tarigida ta Danata jum tarista dana ta tarigida ta jum dim da ta jum nam dakita jum ta dim tum nam ta tarigida danata ta ಧಣತತ ತರಿಗಿಡತಿಗೆ ಧಣತತ ಧಣತತ ದಿಂತ ತರಿತತ ಧಣತತ ತದಿತ ಧಣತ ಧಣ ತದೆ ತಂಗಿಡತಿಗೆ ತರಿಗಿಡತಿಗೆ ಜತ್ತ ತದಿಂ ತರಿಗಿಡತಿಗೆ ತ ತದಿಂ ತರಿಗಿಡತಿಗೆ ತದಿಂ ತರಿಗಿಡತಿಗೆ ತದಿಂ ತರಿಗಿಡತಿಗೆ ಜುಂ ತರಿಗಿಡತಿಗೆ ತಂಗಿಡತಿಗೆ ತರಿಗಿಡತಿಗೆ ದಿಂಗಿಡತಿಗೆ ತರಿಗಿಡತಿಗೆ ತೊಂಗಿಡತಿಗೆ ತರಿಗಿಡತಿಗೆ
Thank you for a splendid performance, Akshada. Now let's prepare for the panel discussion. So ladies and gentlemen, as we dive into tonight's discussion, we are happy to be guided by someone whose life story is an inspiration to us. Growing through the challenges posed by severe meningomyelocele, Sai Prasad Vishwanathan is not just India's first differently abled skydiver, he's also the first Indian with disability to set foot on Antarctic continent. A strong blend of determination and excellence, he has donned multiple hats from being a management consultant at Deloitte to an entrepreneur to a shining gold medalist and an MBA graduate from Indian School of Business. His achievements have not only been recognized in business world, but also in the broader community, being honored as the Helen Keller Role Model Person of the Year. With a gentle spirit but a fierce determination, he is here to bridge our distinguished panel of doctors to all of you. Please extend a heartfelt welcome to our moderator for the evening, Sai Prasad Vishwanathan.
Mic testing.
Our first panelist is Dr. VVS Chandrasekharam, sir. He is the Chief Consultant Pediatric Surgeon and Pediatric Urologist of Ankura Hospitals. Next, we have RSV Sri Krishna, sir. Sri Krishna, sir, can somebody please call him from the dining area? Okay, while he comes, let's introduce Dr. Sukumar, sir. Neurosurgeon from PGI, Chairman and Chief of Spine Surgery, Asian Spine Hospital. Next panelist, we have Dr. Shrikant Vemula, Consultant Neurologist, Director of Elite Hospitals. We have with us Dr. Mehul Shah, Consultant Pediatric Nephrologist, Apollo Hospital and Little Star and She Hospital. Dr. Sujit Omkar, MS Ortho, Fellowship in Pediatric Orthopedics and the Consultant Pediatric Orthopedic Surgeon at Ankura Hospitals. Last but not the least, Mr. Sudhakar, the Treasurer of Spina Bifida Foundation and a proud parent of a Spina Bifida individual.
Thank you so much, Dr. Khyati, for that kind introduction and calling of people on stage. See, one of the most cruel things you can do to a person with Spina Bifida is make him stop others from having dinner. And that's what I'm going to do to you all today. But on a lighter note, again, when Dr. Khyati asked me to be a moderator for this panel and come up with a list of questions, and then told me the esteemed panel of doctors, I had only one question, which is, why do all doctors have bad handwriting? Okay. That was the only thing that was in my mind. No. But she also called me yesterday saying, don't create controversy, so I have to keep that promise up. So let me get on to the list of prepared questions. Here's the first thing. After that medical rap song of full medical terminologies and the beautiful song of Jia Jale Jaan Jale, my job is to be a bridge between the doctors and the civilian people here, apparently. And that's what I'm going to do. So I promise that I will force every doctor to speak the human language and not the medical language. And in case they do not do so, Khyati promised me that she would buzz up. So let's see. So here's my first question to Dr. R.S.V. Krishna Garu. Oh, sorry. Yeah. So here's the part. Now, as we grow up, most women and even men are told to identify red flags in relationships. But when it comes down to finding red flags after primary surgery in a child, how do we monitor motor functions, and what is the right time to intervene for physiotherapy or additional surgery?
Yeah, so the second part I leave it to the experts, but the first part is very important. Each time the child comes to a pediatrician for a visit in the first 1 year is usually at the time of vaccination. So first take home point, please examine the child when he comes for vaccination. Don't just give the vaccine and send them back thinking there are many waiting outside. Often this is the moment when you will be able to examine the motor function. I remember our Guru Sudarshan Reddy sir, as you all remember, he used to examine the child completely even before starting the vaccination. He used to counsel on breastfeeding. He used to ask the mother, Amma dolutunada, kuchuntunada, ninchuntunada. So one is to ask for milestones. Milestones is very, very important. The second, ask for interaction, and specifically for social interaction, ask for their development compared to the peers. And often parents are able to tell you if there are any red flags in the initial few days. Now, when it comes to identifying them, it is important to give them that necessary information. Many parents feel that a little delay here, a little delay there is okay. So make sure that in your discharge summary, when the child is going back, there is a card that tells you when is this child actually supposed to attain motor, sensory, fine motor, gross motor, speech, and social and language milestones. So have this information, one. Second, make sure you examine the child when the child is coming for vaccination. Third, when the child is coming for an illness, often at the time of illness, please ask the parent to come back once the child recovers. You know, the follow-up is very important. Many a time we see children for cold, cough, fever. When you ask the parent to come back for a review, that is when you can counsel on nutrition, on growth, on monitoring. And that is the time they are also receptive, because this visit is actually for follow-up of the child as such, not just for sickness. So these are moments where you can actually pick up. I leave it to the experts on the correct time for intervention, because there are a range of complications. So I'll request them to take that.
Sure. Just to kind of get a detailed understanding, these are interactions that the doctor must have with the patient, yes. Not initiated by the patient or the parent of the patient themselves.
Yes, yes.
Fantastic. Just a follow-up question on that. Earlier today we saw some role model children and adults with disabilities who have done tremendously well in their career. But imagine if Sachin Tendulkar or Michael Jackson had spina bifida. What would they not be able to do?
Yeah, so the issue is related to neural, muscular, and orthopedic issues. So the severity would depend upon case-to-case basis, and also the timely intervention starting from early detection. So the brain most of the time should be able to function well enough. So we do not expect any loss of intellect. These children are just bound by chains. This is how we describe that there are chains to their legs, chains to their arms, but their mind is as active, as good as everybody else. So one, nurture the mind. Second, whatever is the degree of deformity, if it is correctable, please take up immediate identification and then correct it. And as I said earlier, treat the child as a child. There are more aspects to the child than just the walking or the sitting or the talking. So there are different facets to a child's growth. Look at all of them. Sachin, if he was asked to be a doctor, probably he wouldn't have done as good a job as we all are doing now. And we can't do what he is doing now. So there are different facets, and people excel in a certain domain, and some part of it is also fate. So we have to nurture that and ensure that the child reaches the potential, whichever it is, on motor, sensory, or the social language skills.
So just to summarize, there are reasonable assurances that the mental abilities of the child is not going to be affected whatsoever. Fabulous. We move on to Dr. VVS Garu. And on an average, one of the major concerns that parents have once they have a child with a particular medical condition, any condition for that matter, is how many times do they have to visit the hospital and how many times the procedures need to be done. This is something that runs on their back mind. So how many procedures does a child with spina bifida undergo before reaching adulthood?
think the first procedure is going to be the spinal defect repair itself. That is almost a definite procedure. Now beyond that, hydrocephalus, again, in many children we are able to manage it medically with medications, most of the hydrocephalus. Only when it goes beyond a certain limit, they may require a VP shunt. Again, with the availability of good quality shunts, the function of the shunt and the rate of shunt revisions should be much lesser. 25 years ago, we were revising shunts. Once you do a shunt, we were revising them multiple times. But now I think the quality of the shunts and understanding is better. So that's the second procedure, if at all they require. And beyond that, of course, the orthopedic and other issues are there. The basic thing is early intervention. So if you let the deformity to set in, then it is very difficult to reverse it. So you have to look at them early, and then it's, my boss used to say, the treatment starts after the spinal operation. The spinal operation is actually prerequisite for the further treatment. It's not the treatment in itself. So if you do that, and secondly is the evaluation of urinary and fecal continence, or the control of the urine and stool. So even here, if you catch them early, if you assess them early and treat them early, preemptively, then you can actually minimize the number of surgical interventions that they would require. So you can manage most of the urinary incontinence and fecal incontinence medically, with medications and with CIC, without the need for actually major surgical procedures being performed on them.
Sir, but once again, when you say early, what constitutes early in the most severe cases, for instance?
Yes. Now regarding the urinary and fecal incontinence, we tend to assess them in infancy itself. We tend to assess them. We may not do major tests and major urodynamic studies and all during infancy, but all they need is a simple ultrasound examination. And if the child is able to pass urine, of course we cannot determine whether they are continent, the sensation and other things during infancy, but if at least the child is able to empty the bladder without urinary tract infections or any changes in the kidneys. For example, you do an ultrasound, you find that there is a swelling in the kidneys. I'm talking again common language, not the medical language complex. So if you see any swelling in the kidneys developing, which you can see even in infancy in some children, that shows that the bladder is a high pressure bladder. This is a dangerous bladder. So that's a very simple test. Ultrasound is available now very, very easily. So if in an infant I do an ultrasound, I don't see that the kidneys are getting affected, then I would not really push for any further treatment, active treatment in the infant. I would let them grow, but I would keep a close watch. And then, so early means that early. And on the other side is an infant who is already developing swelling in the kidneys. Then we start treating them early with medications to, reduce bladder pressures and maybe institute clean intermittent catheterization even in infancy.
Makes sense. So since we were talking about bladder complications, what are some of the commonly observed bladder complications, and how can they be best managed?
As Khyati has just covered briefly, there are basically, we need to understand the two types of bladders. For me, there are only two types of bladders. One is a bladder that is dangerous to the kidneys. The other is a bladder which is not dangerous to the kidneys. That is what I will want to identify at the first go. That's what I said. When I do an ultrasound, I'm looking at the kidneys. So the difference is, a bladder that is dangerous to the kidneys is very easy to get social continence or to make it dry. Actually, you don't require major operative procedures most of the times. I'm just, so in general. But a bladder which is not dangerous to the kidneys, that shows that the sphincter or the outlet is very lax, very loose. So it's a small bladder, the outlet is very loose, so they keep on dribbling urine. So bladder pressure never rises. So the kidneys are safe. But that bladder is a difficult bladder to actually get social control. So they are the children who might require more of these outlet surgical procedures or augmentations and other major procedures. But the important thing is to identify the dangerous bladder early. So even if you delay in identifying the non-dangerous bladder a little bit, it's all right.
So my next question is to Dr. Mehul Shah. What kidney complications can be expected in these patients, and when and how will they become apparent to parents?
So I think the first question, when would the kidney complications set in? Again, as Dr. Chandrasekharam just mentioned, and which we do understand that children born with spina bifida, neural tube defects, have normal kidneys to begin with. So whatever happens is postnatal, and it's mainly because of the bladder dysfunction. Most often, this bladder dysfunction or neurogenic bladder is a silent killer for the kidneys. Most children would not have any symptoms. Few of them may present with recurrent urinary tract infections, urine infections, and the only symptom in a young child who is less than 2 years is going to be unexplained high fevers. So unexplained high fevers in a young child with a spina bifida should make us think about urine infection, diagnose and treat that. So that would be the major manifestation early in the life. Later on, certainly children who have got bladder dysfunction would have dribbling, or they may not pass urine for a number of hours if they have got a very tight sphincter. That is the second part. Later on, children would manifest with features of inadequate growth because of the damage to the kidneys, which in turn affects their kidney function. So they may not grow as well as they are supposed to grow. They may have symptoms of hypertension in terms of headaches, vomiting, and sometimes they can have repeated episodes of vomiting. So I think most often I would say that they are asymptomatic. Early on it could be symptoms of urine infections with unexplained fevers, or the urine may be very cloudy, and later on it could be features of kidney damage with high blood pressures and poor growth and vomitings.
Family. Thank you so much, sir. My next question is to Dr. Shrikant. And so we have spoken a lot about children. What are the primary neurological challenges that adults encounter, and how are they different from those in childhood?
So I'll follow from where Dr. Chandrasekharam was mentioning. Hydrocephalus, like he mentioned, may not always be treated unless it's symptomatic. Sometimes it becomes symptomatic and they have a VP shunt done. That shunt can become blocked. So sometimes it is difficult to recognize that the shunt is blocked, because individuals with spina bifida may also have other conditions which may mimic a shunt block. They may have sleep apnea, which now there is a lot of awareness about. That drowsy, dull, that can happen. And depression is common in individuals with spina bifida. Depression and sleep apnea can mimic a shunt block. Sometimes they can have overt manifestation like headache, nausea, vomiting, dizziness. When that happens, we should be alert to the fact that the shunt is blocked and repair it. That may not happen in children. The other thing is, like Dr. Khyati was mentioning, the relation between the vertebral column and the spinal cord is established much later in childhood or early adulthood. Because there is a chance of tethering of the cord due to that, the manifestation of tethered cord are seen in adulthood. So that causes difficulty in walking. It may be a spastic gait. It causes pressure sores. It causes urinary disturbances. And generally, lots of disturbances, neurological disturbances, which are not seen in childhood. Then the children, like we were discussing about urinary tract infections, they're much more common in adulthood than in childhood. And sexual dysfunction, that is a predominant complaint of sufferers who have spina bifida. Then cancers can happen, but they're rare. But we should be alert. Screening should also be done in sufferers with spina bifida. Some of them may be more common. Then you can have sleep apnea. I was just mentioning sleep apnea is more common. But the thing which is not recognized is metabolic syndrome. Metabolic syndrome is an entity where people are obese. The waist circumference, when it's more than 40 inches, it's called, along with high triglycerides, low HDL, and blood pressure of more than 130/85, fasting blood glucose of more than 100, it's called metabolic syndrome. That leads to cardiovascular disease, heart attacks, brain attacks, and generally early mortality. That should be recognized. Weight control should not be underestimated in people who suffer with spina bifida. And hypertension alone can also be manifest. So all these things are seen more commonly in adults with spina bifida as compared to children.
That's a lot of information and useful information, Doctor. Thank you. And my next question is to Dr. Sukumar. Yeah. So, what surgical interventions are typically required for adults with spina bifida?
Yeah, as Dr. Srikanth covered almost most of the neurological dysfunction which they might get in adulthood, patient with spina bifida. So normally spina bifida, if you take in adults, I categorize them into three. One is a patient with spina bifida who's not been diagnosed at early age. So he is only diagnosed at adulthood. He goes with for a back pain or some foot weakness or some bladder problem to a doctor, and he's evaluated and they say he has a spina bifida occulta or with a low-lying tethered cord, which became symptomatic in adulthood. So he was an asymptomatic patient. He was normal as anyone, but became symptomatic in adulthood. So that there we can accordingly treat him early so that he should not develop a fixed deficits. The second patient is a one who had already some surgeries before in childhood. As Dr. Srikanth mentioned, he might have had a VP shunt or he might have had a tethered cord detethering at childhood. So these patients, as they grow, so they might again develop a shunt block where we might have to do a revision VP shunts. The problem with VP shunt is once they get blocked, the revisions are very difficult. So when you keep on revising them, chance of infection is there. Then you can't use the same track. So we might have to put the shunt somewhere else. Instead of in the abdomen, we might have to put into the thorax or somewhere else. So there are a lot of complications regarding shunt revision surgeries. So the person gets stuck in that shunt revision surgery. So the first surgery, as Dr. Chandrasekhar sir said, it should be the best surgery. So otherwise, patient is stuck in that revision surgeries. So he might require a shunt revision in a later date because as child grows, the shunt tube length might be inadequate. So it might need a revision. Then the spina bifida, where a tethered cord was operated in childhood, he might become again symptomatic, what we call as retethering. The cord becomes again attached or stuck somewhere, and again a patient starts developing a retethering with a typical again tethered cord syndrome can happen. So again these people require revision, which is again difficult because when a child has been operated, there will be a lot of additions, scar. So redo surgeries are always dangerous. Though we have excellent technology nowadays in the form of neuromonitoring, but still these are dangerous. So the two main things are the revision surgeries in adults, either a shunt or a retethering has to be done. The other non-neurological like urology procedures might, they might require revision, or orthopedic surgeries they might get revisions. The third thing is a person who was having a spina bifida and became paraplegic, or already he has a weakness. So managing such patients in adulthood is difficult. There's a lot of social issues, so that need to be have a multi-centric approach. So this is commonly we see in our practice.
Sir, most of the children or adults with spina bifida also lack sensation and pain. So detecting that pain becomes very, very challenging before probably turns into very severe. For instance, let's say I have fever. Now I do not know if it is symptomatic of some of the underlying root causes or if it's just an infection, viral infection. So do you recommend any timely interventions even without the symptoms arising? This question is to both you and Dr. Srikanth, sir.
Definitely a person who has undergone some procedures in childhood and has led a normal life and became an adult, then definitely whatever problem he gets, usually the parents' mentality is that they equate any symptom to the surgery or the problem which he had dealt before. So even a simple constipation, they think that it is because of the previous surgery. Definitely, yes, if a patient has any fever or some kind of dysfunction, we should rule out the previous surgery problem first. Then we go to a new problem. Like say patient has a fever with headache, definitely we should rule out a shunt block or a shunt infection than a regular viral fever or a headache. So always we need to keep in mind that this patient had a shunt surgery in childhood. So always he should remember that the fever he can get because of this implant related issue. Then again, a patient develops a urinary dysfunction or a burning micturition, or with the frequency, he goes multiple times for a urine. So you should not neglect that. So it might be because of a retethering, and we miss that, and we are treating for a simple urinary tract infection or something else. So we might miss again. So definitely, when you have any symptoms, definitely go to your primary physician who knows you, who knows your history, and try to rule out that first, and then go to the other causes.
So same question to you. Same question to you, sir.
To me?
Yeah.
About the pain?
Yeah,
How
yeah. So since most children and adults lack sensation, so how, and let us say there is an infection, how often do we associate that with the root cause or externally? In other words, how many times do I voluntarily go and attend screenings, assuming that something is wrong at a...
So the question over here we're trying to ask is pain and painlessness in spina bifida. Okay. So which is the real pain? What should we actually visit a doctor for? And what are the things which can happen because of the painlessness? What are the dangers of painlessness? Okay. Both.
Yeah. So personally, I feel painlessness is a bigger problem because lack of sensation leads to ulcers. Ulcers lead to infections which may be fatal because they're not detected early. So the individuals land in septicemia, and sometimes it can be really disastrous. But pain is easier to manage because pain leads a person to seek medical help earlier. Pain can be managed. There are two types of pains in spina bifida. One is a neuropathic pain, the other is a musculoskeletal pain. Neuropathic pain it is more common with higher level lesions like thoracic and other types of lesions, not so much common with lumbosacral lesions. And that pain can be managed medically. It need not have a surgical option. But painlessness, we should, rather than going to the doctor, the patients themselves should be trained to examine themselves, like for ulcers. They can ask the family members or others to examine if it is inaccessible to them. If they can see it, they should look for it. Because they've been trained by the doctor, these are the common areas. For example, in let's say lumbosacral lesions, ankle and foot are the common areas. In higher level lesions, you have lesions in the buttocks or the knees or sometimes thighs. So once the doctor tells the individual that these are the likely areas, you keep checking. Then you can avoid visits to the doctor. Whereas pain will take you anyway.
So my next question is for Dr. Sujit. So what types of deformities are commonly seen in children as well as adults with spina bifida?
Yeah, well, the deformities in spina bifida depends on the level of the lesion usually. If they are upper thoracic or the thoracic level lesions, mostly we see the paraplegia, that is loss of sensation of the lower part of the body and in the limbs. And if it is upper lumbar lesions, sometimes you get the hip function. However, sometimes you may have the hip dislocations as well. As you come down, the deformities tend to be less severe. In lower lumbar and sacral regions, most commonly you see some flexion deformities of the knee, or most common is the foot deformities. Like it ranges from the club foot to calcaneus deformity, where the heel is pointed downwards, the toes upwards, or the equinus, where the opposite happens, or the cavus, very low sacral lesions, you see the cavus deformity, where there is a concavity in the sole of the foot. So most of these patients, we should try to keep the deformities as minimal as possible, try to make them braceable, try to make them mobile, not always ambulatory. They should be able to move from point A to point B. That is our aim in treating these patients.
And as a follow-up to that, is a very important question. How much do these orthotic devices or appliances cost for these patients?
Yeah, that's a very valid and important question, because like I told you, the main aim is to correct the deformities and make them put in a proper brace. All these braces, the aim is to help them move better than what they were before. So the foot deformities, if you say you can use AFOs, what we call ankle foot arthrosis, it starts from 5,000 to 6,000 rupees. It may go up to 20,000 rupees as well. And KFOs will be around 20,000, 15,000 to start with. And HKFOs, if they are above, I mean, for the paraplegics and upper level lesions, it starts from more than 20,000. And most of the paraplegics, they need a wheelchair, which can start from 5,000 to 6,000 rupees. And if you want a motorized, I think it starts from 75,000 rupees.
Thank you so much. My final set of questions to Mr. Sudhakar Garu. So, what were some of the misconceptions or fears about spina bifida that over the years you found were baseless?
Yeah, the first and foremost fear, which that doctor had told me when my daughter was 6 hours old, was these would all be the problems, would you like the child to live? I said medical field will develop over the years, so make my child live. I said I want the child. But I heard next day, similar condition, the child was allowed to die. So that's the first misconception, is that it's not good to have the child, it should not be there. Secondly, as doctors have also assured and said, mental energy is always there for them. They are very good mentally. So the misconception was, even sometimes we also got, was whether she can have normal education. But over the years when she went to school, college, in the normal course, she completed as the normal child. So that misconception that we cannot provide proper education is not correct. But yes, there are not the misconceptions, there are some issues, like the question you have asked, what is the cost? So the cost of utilities, the cost of facilities for the generally disabled, especially the spina bifida, are very high. I think all of us should work to bring down those costs to help the spina bifida children to have a normal life, and also the parents to be able to afford them. So the main activity of all those who are associated should be to ensure that the facilities are made cheaper and affordable to everybody.
So in that context, I'm assuming that many insurance companies do not cover for many of
this is not covered. This is not covered insurance.
So on a positive note, have you found any organizations that offer financial support that has allowed you to go ahead and have these interventions in a timely manner?
No, I have not found any such organization, but we have to form one. We ourselves, our Spina Bifida Foundation, one of the efforts which we make is to help the people who are not able to afford the operations. So we have sponsors, and then we collect funds and we help people to undergo the surgery. Of course, because of Karmarkar sir, Lilavati Hospital bears 50% and we pay 50%. So the people with low economic strata can get the treatment. But yes, there is a need like what is there in Western countries. Some groups have to be formed to help these patients financially.
Sure.
Yeah. So I think this is a felt need now. We've realized that this is a problem that the child has to live with. And now you have to make the world better for them when you cannot cure it. This is not something that you can cure. So on behalf of Indian Academy of Pediatrics, our full support to the foundation, we have a very strong army of 1,800 pediatricians under our network, whom we are able to reach out on emails and various workshops like this. And half of the audience here were all pediatricians, from students till very senior colleagues who are with us here today. What IAP can definitely do is spread this message strong, make sure this comes up in our newsletters, an article about this in our journal. We talk about it, only then we take this forward. So we'll make sure that we'll do it. And the theme of the president for the year, each of us has a theme. Last year it was breastfeeding. This year it is developmental pediatrics. So we'll be focusing on these core aspects wherever we go, ensure that this word spreads. And this is how each one plays a part. We may not be able to solve the problem, but we can make life better for them.
Thank you. Thank you. My last question. Sure.
Because charity can never work on a longer time basis. What can work is, we have to make an appeal that spina bifida or any congenital anomaly, it's not as if they are making it up to get insurance money. So insurance, why does it not cover? That is the thing that we have to do as IAP, as a body, lobby with the ministries, whoever are responsible, and make sure that these congenital anomalies are covered. Because charity can work only to an extent, and that's not what we want to take, I want to take, you want to take, or even a spina bifida parent wants to take. It's his right. Everybody gets insured. It is a right to get that. So that is where our advocacy should work.
Yeah, if you are able to lobby with the government, this is a good suggestion that insurance companies should cover them, and government should allow that expenditure, that cost of what they are paying to them as a CSR expenditure, eligible expenditure. Then insurance companies will come forward.
Over here, I would like to mention there is a company, insurance company, Star Insurance, which does cover, but that is before the baby is born. Another thing, what you can make life simpler for children who have difficulty in getting up and all, is ramp. I guess, making that ramp would make things easier for everybody. So, yeah, big thanks over here, whoever has, Kathy, we had informed her that we would need a ramp. So, those small changes also can make things easy for them and make life comfortable. So, I guess, yeah.
I want just one word.
Please.
So, she's right that the Indian Association of Pediatric Surgeons, the IAPS, we have actually talked to a lot of insurance companies. In fact, this happened more than 15 years ago, that there was an insurance which the Star Health had started. But the problem is, there was no market, or in the sense there was no propaganda to it. The insurance company themselves did not want to take it public, make it public, because they were not sure whether they would be the losers or the gainers in the game. And pediatric surgeons being a small organization, we are probably 2,000 of us across the country, 2,000, 2,500 of us. We don't have the strength to actually take it forward in a very big way. Let me be very frank. We are a small organization. So if the pediatricians actually can support us, they are very strong. They are very big people. So if Dr. Jagdish Chandra is there, senior pediatricians are here. I would request them that if they, and the neurosurgeons, if they can actually support us in this, then I think it will go a long way. Yes, there is an insurance available. The problem is who's going to actually push it, further. That's the.
Yes, sir. I think, as you have said,
I just want to add, the current finance minister for home is himself a pediatric surgeon. So their national conference is going to be held in Aurangabad this, I think next month, I think. So maybe people can present this to him, and he's coming, he's the chief guest there. So and he's from Aurangabad, and the conference is held in Aurangabad. Yeah. So maybe, see, it's all because why I'm telling from my own experience. I have a small hospital for a spine hospital. When we were applying for insurances, there was no code for endoscopic spine surgery, nowhere in India. Then we presented our this one that we are doing this for the benefit of the patient, and Star Health agreed, and they created codes for this. And later, every insurance company agreed, and ours is the first hospital in India to make this happen for the endoscopic spine surgery. So it's all, as Dr. Chandrasekhar said, we need to push and present ourselves the necessity and the need, and politically also. So that is very important.
Yes, sir. I think it's a valid point. Last note, IAP is part of the state task force, with task force on immunization. We are part of the RBSK program. We are the ones who actually give our input to the document that goes on for training. We are also the faculty for many trainings, and government has been receptive, at least in the past few years. They listen, and it's all about how you present it to them. If you put across a pitch wherein they are also benefited, to be frank, then they definitely take it up. And that's how RBSK has come up, despite disabilities being there for decades. And it is the current government which actually took it up. So it is all about how you project it, present it, and then as a group, take it up. And Indian Pediatrics Association, it's a very, very strong body, and it's our commitment on the stage that we'll do all that is required. And as I said, whatever is in our hands, we'll definitely do, and it's a long journey. We'll probably make the beginning, and everyone join us so that we take it to greater heights. Thank you.
Thank you so much, sir. As always, finances drive passionate conversations. I will go ahead and finish off with one question, final question. My grandmother believed that we should never see three people in life, a lawyer, a police, and a doctor. Now, what were the psychological fears and what were the strategies that you used when you had to visit a doctor a number of times, especially when you had a child with spina bifida?
So, once our primary aim is to protect our child. So, visiting doctor was not a pain, but it was a very pleasant one, especially with the current set of doctors, always welcoming us with suggestions rather than putting us into more troubles. So my daughter was, when she was born, the backbone was corrected, but the doctor said, I will wait for the shunt, I will not do the shunt. So then some other doctor suggested, why don't you try homeopathy? So I went to homeopathy doctor. From 15th day I started homeopathy. My pediatric surgeon, who said after 1 month he will do the shunt, he said we will wait for 1 more month. And then after that he said she doesn't require shunt. So if a commercial doctor was there, he would have conducted the shunt on the first day. So the way doctors are supporting us, it was very pleasant always. I never felt that going to them is a pain. So thankfully I thank all the doctors, especially Dr. Karmarkar, who has given us a different life. We were in a difficult situation. So it was never a trouble. Yes, in olden days they used to say, because my grandmothers used to say, if you go to a doctor, you have to sell your bangle. So that situation is not there now. Doctors are very great human beings today.
That's wonderful. Thank you. So that's pretty much what I had for this panel. And thank you to all the doctors and everyone present here. And I will not stop you from the dinner right now. Okay. As Kathy might.
Just 1 more minute. I might have to stop. I request Dr. Santosh Karmakar, sir, to please hand over the mementos for all the panelists.
I think we all must thank Dr. Khyati and Dr. VVS Chandrasekharam. A big round of applause to both for really putting up such a good program today, especially Dr. Khyati with Dr. VVS's guidance have been interacting with us for the last 2-3 months to get this together. And congrats and wish you the best.
Sir, it was your brainchild that we all followed, sir. Santosh Karmakar, sir, a big round of applause for you for initiating the foundation. To continue with our performances, next we have Amar on the tabla. I request Amar to take his place.
Hello, check. Thank you so much. Thank you so much. Thank you so much to the organizers for giving me this opportunity. Yeah, thank you.
Thank you so much, Amar. That was a wonderful performance. A big round of applause for Amar once again. Now I'd like to hand over the mic to my dear friend Chandana, who is going to take over from here, and she's going to talk about inclusive excellence from the Spina Bifida fraternity.
Thank you, Dr. Kathy. It's been an honor. Now we are embarking on a very special segment called Celebrating Inclusive Excellence. And I could assure you the next 10 minutes is going to be wonderful. So all eyes up here, all ears up here, you're going to have a good time. And within this segment, we spotlight individuals with Spina Bifida that have achieved remarkable feats. And today, we have the privilege of hearing their inspiring stories, moments of pride, and aspirations for the future directly from their own perspective. The process of hearing their stories firsthand has been wonderful on my part, as I was reaching out to each individual and I had the wonderful conversations with them, and some of them are here today with us. First up, we have our first speaker, Mr. Sailesh Ramakrishnan. He's a dear friend of mine, and it's going to be hard to comprise everything in a couple of sentences to describe him, but I'm going to try. He's a national pistol shooter and a principal consultant in the field of structural engineering. He's also the founder of the JS Group, an accomplished entrepreneur with a passion for travel. He drove 600 kilometers from Bangalore to Hyderabad yesterday, and everybody knows that now, so let's give a round of applause for that. And he is here with us today to share his journey and insights with my story.
Good evening, one and all. First of all, thank you, the entire Spina Bifida organization, for giving me this opportunity. Thank you, Chandana, for giving such a good intro. I never expected this. So here I am to throw some insights about how my life has been through from starting till now. So as most of the Spina Bifida individuals, even I had my equal share of finding and most accommodating education institution, but still I was lucky enough to get one, which was not accessible, but the people over there were kind enough to support me during my entire studies. From there on, when I went to graduation, the graduation part was the most thrilling part, as in my college was situated nearly 25 kilometers away from the city, which had no access to taxis, and the only mode of communication was college bus. And the college bus, the staircase are nearly 6 feet high. And I was always in the scarcity of that I might break my bones. And this was in the year 2015. And that's when that led to me starting to drive. And that's when I started to research about driving for specially abled, and I was fortunate enough to find that there are people who modify cars which we can drive with hand. So then on my driving journey started. Today I've completed nearly 500,000 kilometers in driving from north to south, Kashmir to Kanyakumari. I've completed nearly 15 states in and around. I also do my traveling most of the time solo. I go by with the tagline, enjoy the journey than the destination, because most of the destinations in India are not accessible. So I started to live with that tagline, and hence today I am a traveler also. So coming back to my professional life, I am a civil engineer by profession. It's a weird combination, person in crutches and civil engineering, but my passion of civil engineering made me to get through it, and today I am a graduate in civil engineering. I did my couple of years working in a firm called Atkins, where we used to work for good 12 hours a day, and that's when I realized, okay, maybe this is not for something on a longer run, and I didn't want to be working 12 hours a day for next 40 years, and I very well knew that my body won't be able to support this. So there was a need, and that need led to me getting into the field of entrepreneurship. So I started my own firm in the year 2020, and we were unstuck by extreme unfortunate events. COVID happened. We lost many people, and I also lost one of my best investors, my backbone. I mean, I had to give a special mention to her. She's none other than my grandmother, so who has been extreme backbone. And then we lost many other people who were there as a backbone to my startup, but it went down. So in a span of 3 months, we were forced to shut it down. And then in the search to attain financial independence, I couldn't give up, and later on I started another firm called J's Group. That's what gave rise to J's Group. Today J's Group deals with hospitality industry. We have a couple of stays which deals with specialized stays, unlike other stays. We offer scenic views such as beach view and hill view. And we also deal with investment banking, where we are into take finance from certain people, and then we maintain portfolios. That's what J's Group is all about. And when I did this from 2 years, I was again with a man of someone who always keeps on going, what next? Again, the same question popped up, what next? And that's when I saw Miss Avani Lekar. She has been a great inspiration for me. She's none other than a para rifle Olympic winner. She's a gold medalist. So when I saw her, that's what inspired me to go and try out pistol shooting, and which started as a hobby shooting. Today I represent the state of Karnataka in nationals. And this Thursday is my nationals, and the next day after that I'll be playing my selection trials for the country. So hopefully I attain my goals where I wanted to. And also my vision and mission is to create a template for every differently able person to attain financial independence, so that they could live a life other than earning. So here the primary focus has always been earning. Most of the people who approach me, who are specially able, they are into looking for some kind of job so that they can live with a dignity. So I wanted to create a template where people can create some money generating, or as in finance, that can keep them for their living, and then they can start living their life. Life is all about just living. It's not just about earning money and then saving up in the bank account and then dying with not experience. So I don't go by that. So I want to live my life to the fullest, and I also want my fellow mates to do the same thing. So hence, my mission is to create this template. I hope one day I achieve this. Thank you so much. Thank you for providing this wonderful information. Sir, pardon, sir? Road trip, yes, sir. So road trip, as I mentioned, nearly 500,000 kilometers I have covered throughout India. I have driven from Kashmir to Kanyakumari, from west to east, nearly 15 states. The southern states has been completely done. Tamil Nadu, Kerala, Karnataka, Goa for partying especially, Andhra. From Madhya Pradesh to Maharashtra, I have stepped on everywhere. More it's like not stepped, my tire has been there on everywhere, because most of the places I can't get on due to the accessibility problem. So my tire has been to most of the places. I enjoy the journey. So it's been a wonderful journey. I mean, I've never expected the day when I was having the steering in my hand. I never expected to give such a freedom. Today it acts as a personal room to me, as in I can travel anywhere, any part of the world with this. It gives me such a good freedom that where I can go about, explore things, new people. A lot of new opportunities came because of my traveling, sir. It's mainly because if I didn't travel, I need to always be dependent on my parents. because of that because both of them were working and they didn't have the leisure to take me out for coaching classes or college or anywhere. So this gave me the freedom to go out and explore. So I would encourage every one of you all, go out, explore. There is no limit. You people can do it. Like, it is all modifiable. Everything can be done. It is bit frustrating to start in the beginning. Like, people will come across, like, but that's fine. We have hurdles everywhere. So I would just say, just start. Whoever is here, who have the benefit of can try it, please go do it. Don't wait. It gives immense satisfaction and moreover leisure. You can go literally where you want. The freedom which you have never experienced, you'll be experiencing it in the future. So I also want to promote this driving. It's about mobility. Not much people talk about it. I mean, especially parents with differently abled, sorry if I'm taking more time. So especially parents with differently abled, most of the time they are worried, okay, we already have a problem. What if the person meets with an accident? What if my child meets with an accident? When I took the statistics, when my parents were worried about it, when I took the statistics, I showed them 0.1% of the accidents happening in India are done by physically challenged. So that's negligible. We can easily neglect it. So that's fine. And remaining, if it still happens, it's up to destiny. We really cannot, no matter even if you're in house, things will happen. So go ahead, explore, start your own company, whatever it is, just go, give your hands, try on. One life, just live it to your fullest. So, and also I have a special request to Karmakar sir and the foundation. Sir, it has been really nice to have the foundation in Telangana. Me being from Karnataka, I would like to have one startup in Bangalore also. So hoping Spina Bifida Foundation sets up its map in Bangalore, Karnataka also very soon. Already there. Okay, Dharwad. Dharwad is northmost Karnataka. We want it in Bangalore, southern India. Tamil Nadu, Karnataka, Kerala. We'll have a unified place. Bangalore is also, other than traffic, everything is fine with Bangalore. Bangalore, the only thing is traffic that we need to take care about. So I really... Definitely, sir. That'll be my pleasure to do it. Definitely, sir. I'll 100% give my best. I'll do it. Definitely, sir. Thank you so much, sir, for recognizing it. It's been 8 years since I started my driving. In 2015, my first year of graduation, I started. I was just telling my friend that in these 8 years, I've never felt so happy that for driving a car. And today, I'm like, I've driven in hilly terrains, snow terrains, a deserted place, but driving in this road, and I was really happy. The amount of reception that what I received today has been great. So again, one and all, thank you all so much for listening patiently to me. Thank you, Chandana. Thank you, doctor. Thank you, everyone. Well, she's scared to sit in the car only, doctor. So we have to say. She doesn't advise people to go above 100 or something. So it's a bit. Okay.
Thank you, Sailesh, for sharing your story with us. Along with having a multifaceted talents that you have, you surely can be a motivational speaker next year, maybe? We can see you over at TED Talk. Yes, of course. Thank you. And as we continue celebrating the inclusive excellence, I'm very excited to present a series of videos featuring some remarkable individuals with Spina Bifida, who are not only my good friends, but shining examples of strength, resilience, and success. And from the SP community, once and for all, I just would like to thank Dr. Santosh Karmakar and also the foundation itself for creating a community that we get a sense of belongingness. It feels like a home away from home. And I'm sure everybody here feels that way. Everybody already feels like we know each other for a long time. And that is something that I would like to convey on behalf of every single person that I call as friend here. Let's hear their voices and experience as we celebrate their journeys.
talking about myself, I am a Spina Bifida individual, and if I talk about my professional journey, I am an HR professional having a 4+ years of experience into HR, currently working at Tata Power. Apart from that, if I talk about my hobbies, I love to sing, play guitar, and read books and paint sometime. If I talk about my other part of my profession, I am a founder of We Can Club, where we work on disability empowerment and independence, where we conduct a lot of workshop towards giving them an independence and earn money. Apart from that, in sports, I love to swim, and I'm a professional para badminton player. So that's it about myself. Thank you.
Hi, I'm Aditya Mandan, the founder of Strengthor, an online holistic wellness platform where we promote strength from all perspectives, that is physical, mental, and emotional, specifically for physically challenged people. I'm myself a wheelchair user, a national level para powerlifter, a certified fitness trainer, an accomplished professional with more than 10 years of work experience, and a published poet as well. At Strengthor, we empower people to rise above all the challenges of their life and fulfill all their dreams and aspirations. We are on a mission to impact lives of 10,000 people who are motivated and dedicated to make a positive change in their life. So if you are one of those people, contact us, and together let's make the impossible possible. Thank you.
Hello everyone, I am Hope Teresa David and I am 12 years old. I was born with Spina Bifida meningomyelocele.
Hello. I don't have experience with mic, so yeah. So full time I work in a product company as a customer success manager. But besides that, I have passion for sports and fitness. So I started my journey as a para powerlifter, and that's when I realized that there's a need to, have a holistic view of strength from mental, emotional, as well as a physical perspective. So while continuing my journey, I got myself certified as a fitness trainer, and then I started this initiative, Strengthor, wherein we don't just provide physical exercises, but we also cater to physical and emotional aspect of it. And recently, we have actually expanded and onboarded a team of experts, wherein we now have a psychologist on board, we have a manifestation expert on board, we also have a transformation coach on board as well. As well as we have also onboarded a financial expert who can actually guide physically challenged people to be financially independent as well. So trying to take care of all the different aspects where these physically challenged people would need assistance, and trying to give a holistic approach to wellness. I do online counseling only. That would be amazing. I would be love to be associated with your organization. I would love to do that. Thank you.
Hello everyone, I am Teresa David and I'm 12 years old. I was born with Spina Bifida meningomyelocele. I play two sports, wheelchair racing and wheelchair tennis. I have taken part in various runs. I have taken part in Dubai Marathon 2023 and I finished 4 kilometers in 35 minutes. I also play wheelchair tennis and currently I am training in Bangalore. And one day I will represent our country India in Paralympics. Thank you.
Hi, my name is Pranav Banage. I'm a 29-year-old. I have completed my graduation in Bachelor in Business Administration and since 2016 I'm working in Union Bank of India. Now I am posted as Assistant Manager in Human Resources Department in Greater Pune region. I got promoted as an Assistant Manager last year and has been posted into Pune region. Since then I am living in a Pune city all alone. Certainly, shifting from my hometown Aurangabad to Pune has been a life-changing experience for me and it has taught me many things. Along with my job, I keep some time for my hobby. I'm a digital artist and I do draw on my iPad whenever I get time. And in future as well, I would like to dedicate a little bit more time for learning that particular art in detail. At the same time, I would like to scale up in my banking career as an officer. Thank you so much, Spina Bifida Foundation, for giving me this opportunity. Thank you.
Hello everyone, my name is Aitri Parekh. I'm 18 years old and I have been a Spina Bifida patient since birth. My greatest achievement so far would be that I have been able to walk and stand a little with support despite having Spina Bifida. I have also been able to pass standard 10th with great percentage and choose science stream to study further in. I have been in great health and overcome many obstacles thanks to my family and Dr. Karmakar sir, who has always been there in my Spina Bifida journey. I've also participated in this EU in Spina Bifida. We went through dancing, which I really love. My future goals would be that I want to pursue medicine and research after HSC examination. I firmly believe that we shouldn't let anything withhold our abilities. Thank you.
Hello everyone, I'm Mahi Rude. I'm one of the members of Spina Bifida Foundation and a Spina Bifida individual. I'm a first year dietitian student and I represent Mumbai wheelchair cricket team as I'm the vice captain of it. Also, I was awarded with the Excellence Award of the Year by Naira Foundation. It was an honor. I never thought of playing any sports in my life, but Dr. Santosh Karmarkar sir always used to tell me the stories of Spina Bifida patients who were swimmers and athletes. I would like to thank Dr. Santosh Karmarkar sir and the entire team of Spina Bifida Foundation because after my parents, they played the major role in my life as well as in my career. I have faced many health issues and enormous doubts regarding my career, but in result, I got Dr. Santosh Karmarkar sir as my guardian angel. Thank you.
Good evening everyone, my name is Merlin DeMello. I'm working in Accenture as content moderator. My hobbies are cooking and watching informative videos. Apart from this, I'm national level Paralympic swimmer and arm wrestler. So far, I have won 33 gold medals, 5 silver medals, and 3 bronze medals in various district, state, and national level swimming competitions. I have also won 2 gold medals and 1 silver medal in arm wrestling competitions. Thank you.
कैसे हो आप सब? मैं खुशी हूँ। मैं स्पाइना बायोफिडा से पीड़ित नहीं कहूँगी, बट मैं स्पाइना बायोफिडा के साथ अपनी पूरी लाइफ जी रही हूँ।
We have some mementos for all our Spina Bifida achievers. So I request VVS Chandrasekharam sir to hand over the mementos. So first I'd like to call Chandana. Yeah, you're first. Come on. Achievers.
have Sailesh. Aditya Madan. Kosha Modi.
A big thank you for everyone for attending, contributing, staying with us, and for making this event such a success. Thank you, everyone. Hope to stay in touch and lead the Telangana chapter forward. Thank you, and yep, that's it for the night. Signing off. I've been lucky to be your host. I'm Dr. Khyati. Achievers and the parents to come to the stage for a photograph. All the achievers and parents.